Good morning, everyone. A very good morning, everyone. மைக்கமா கேக்குதா?
எனக்கு லிங்க்
வேவ் ஆகுது இது. இப்ப பேசு, நான் வெளில போறேன். Good morning, everyone.
ஒரு மொபைல் மட்டும் வச்சு ரெண்டு மொபைல் வச்சு
சரி சார், லிங்க் எங்க இருக்கு?
மொபைல்
யார் அனுப்பிருப்பாங்களோ எனக்கு தெரியல.
கரெக்டா இருக்குப்பா.
I welcome you all for the internet
ஜெனிஃபர்
on the role of artificial intelligence
ஓகே
in modern medicine.
கொடுத்துட்டா அவங்க
ஆரிஃப்
அலோவ் பண்ணிக்குவாங்க.
ஆரிஃப்
ரொம்ப லேட்டா
ஹலோ
நான் பண்ணலாம் பட் நான் பிஸியா
ஷகிலா ஜெனிஃபர் ஓகே ஹலோ ஹலன் கத்துறனே கேக்கல ஜெனிஃபர் ஓகே
எதுல போறீங்க?
Coming together is a beginning. Keeping together is progress. Working together is success. A very good morning to everyone gathered here. It gives me an immense pleasure to welcome you all for the international seminar on the role of artificial intelligence in integrating traditional and modern medicine, organized by the Department of Pharmacognosy, Periyar College of Pharmaceutical Sciences, Trichy, in association with the Tamil Nadu Dr. MGR Medical University, Chennai. To mark a great ending, let's begin this program without any further delay. I would like to invite Dr. S. Shakila Bano, Head Department of Pharmacognosy, to deliver the welcome address. Respected chief guests, dignitaries on and off the dais, esteemed speakers, invited guests, respected principal, vice principal staff, dear faculty members, research scholars, students, and friends. A very pleasant good morning to all. It is indeed a moment of great honor and joy for us to extend a warm and heartfelt welcome to each and every one of to this international seminar on the role of artificial intelligence in integrating traditional and modern medicine, organized by the Department of Pharmacology. And advance towards a shared vision. Now, I would like to invite our leader, our ever dynamic principal, Professor Dr. R. Sindamarai ma'am, to deliver the presidential address.
Camera on. Camera on. Unmute பண்ணிருக்கேன்.
என்ன அப்பதான் கேட்கும் ராஜேஷ் மேடம் பேசுறது.
A very pleasant morning to one and all gathered here.
It's my great honor to address the gathering in this international seminar entitled The Role of Artificial Intelligence in Integrating Traditional and Modern Medicine, accredited by the Tamil Nadu Dr. MGR Medical University, Chennai, under the Continuing Education Program with 10 credit points. This topic is both timely and relevant. Artificial intelligence is rapidly transforming the pharmaceutical and healthcare sectors from early diagnosis and drug discovery to personalized medicine and virtual care. What once took years can now be done in months, thanks to AI-powered tools that improve accuracy, speed, and therapeutic outcomes. At the same time, traditional systems like Ayurveda and Siddha offer deep time-tested knowledge. The true potential lies in integrating this ancient wisdom with modern AI technologies, enabling us to rediscover, validate, and enhance traditional remedies. Today's seminar is not just about understanding these tools, but about empowering you all, the young minds of future innovators, to lead this transformation. You must collaborate across disciplines, be open to innovation, and enhance your communication skills with professionals. This is how leaders are formed, not just in laboratories, but through active learning and involvement. This is my sincere message to all young participants. We are deeply honored to have Dr. Mahadevan, the chief guest of today's program, who is well known to me since he was working in JSS College of Pharmacy, Ooty. The professor is a best friend of mine and a good academician and a researcher in the field of phytopharmacy and phytomedicine. With over 30 years of experience working both in India and abroad, his presence today brings immense value to this gathering. Thank you, sir, for readily accepting our invitation despite your busy schedule. I also extend a warm welcome to the speakers, Dr. Jaykant, Associate Professor, Department of Pharmacology, Sri Ramachandra Institute of Higher Education and Research, Chennai, and Professor Dr. Ravichandran Veerasamy from AIMS University, Malaysia, who will be joining us shortly. I would like to invite Dr. Raghavan, one of the renowned distinguished professors retired from NIT Trichy. Welcome you, sir. The delegates from Malaysia and various states such as Karnataka, Uttar Pradesh, Madhya Pradesh, Andhra Pradesh, Telangana, Maharashtra, Chhattisgarh, and of course Tamil Nadu. And the delegates from various fields like Siddha, Naturopathy, Arts and Science, Engineering and Technology, including pharmacy colleges, are highly appreciated. Also, the delegates are showcasing more than 90 e-posters and 44 oral presentations, totally 134 virtually. So we received 134 e-papers in this international seminar. At the outset, I would like to thank the evaluators, Dr. Parimala Devi from Dr. Kalam College of Pharmacy, Dr. Madarkodi from Wales University, Chennai, Dr. Badivu from Madras Medical College, Chennai, Dr. Krishnaveni and Dr. Sedramani from Madurai Medical College, Madurai, for their tireless efforts in adjudging the Best Paper Presentation Award. I hope this international seminar will serve you as an exceptional platform for exchanging your ideas and views. I thank all the principals of the participating colleges for their support. Also, I congratulate all presenters, the in-house participants and student volunteers. Let us embrace the opportunity to explore, engage and innovate. Thank you all.
Thank you, ma'am. Now I request our well-wisher, Dr. Raghavan sir, retired professor, Trichy, to felicitate the gathering.
Dear students, I have come here like you only as a participant. The subject is a unique subject, so far not heard in many of the pharmaceutical college. This is AI in integrating traditional medicine and the conventional one, first of its kind. And definitely you should take home message from this really international conference. Many simply say international, there won't be any person other than India. This is different. And in another 5 years, this college is going to attain golden jubilee. So that way, the credit goes to evergreen and ever young, permanent principal, Dr. Sindhamani. And I am only two, three sentences I want to tell. I am very much associated with Dr. Veeramani's Periyar University of College of Engineering. All the deans, principal, staff of Periyar Medical Engineering College and Polytechnic of ECE were my students. So I am such a old person. But here I have come. I want all of you to realize the importance of the topic. Another thing I want to tell, I have heard Dr. Kalam talking about Periyar Pura, PURA, is a very pet project of Dr. Kalam. And today only I come to know your contribution in that Pura. So you are doing silent revolution. And I understand this college is such a old, it's almost, there are so many pharmaceutical college, but not a heritage college like this. I know after the pharmacy college of near MMC, Annamalai, in that I don't know whether I can be good if I say this is the third in the line. So last but not the least, about the chief guest, I would like to say very happily I did my schooling very near to your pharmacy college in Udi. So that is the relationship of mine with you. In any case, regarding technically what I want to tell you is maybe your principal, Dr. Sendamarai, will enlighten you. There is something going on in a very big way that is telemedicine. Sitting in a village and curing many things at a formal places. That's what Aravind Eye Hospital got international award. மதுரையில் இருந்துகிட்டு தேனியில் இருக்கிற பேஷண்ட்டை not diagnosis, therapeutic he did. That's why he got Padma Shri, Padma Bhushan, Dr. Namberumal Sami, whom we lost 1 month before. So some other college having principal has given me unexpected honor. I will definitely come to your college, talk for 1 hour of what we are doing in telemedicine. So telepharmacy, all these things you should take home. Once again, I thank your principal. The first question I asked was whether Dr. Sindhamari is there. They immediately took me to her room. So there is nothing exaggerated if I say I can very well call her Nirandara Workaholic Mudal. I wish you all the best. Thank the Lord. And 150 papers is not an easy job. The judges are all from MMC, then so many reputed colleges. So that way, the way in which your papers are judged will definitely go up to the level of journal papers. Thanks a lot.
Thank you so much for inviting us. It's always right to always right. Now it's the right time to honor my genius. Request Mr.
sir, by adorning the song. May I request our Vice Principal, sir, to present the memento to the chief guest. Thank you, sir. I request our principal ma'am to honor Dr. Raghavan sir by adorning a shawl. Thank you, ma'am. Now, I would like to invite our benevolent and ever supportive Vice Principal, Dr. G. Krishnamurthy sir, to felicitate the gathering.
Good morning. Good morning to all. Dignitaries on the dais and off the dais. Have a great day at PCPS. My dear delegates, you have come from all the way from different colleges. We welcome you warmly, and this is a pharma world. You can enjoy your presence one day here. You can make use of the knowledge center, library, and you can go around the college and see what are the developments. We are very happy to see all of you from other institutions. So as a part of this day, you have joined here for the international seminar. Welcome you all. Interact yourself with the resources and also with your colleagues or the other delegates so that you can improve your knowledge and your activity. So this part of seminar, international seminar, I wholeheartedly congratulate the Department of Pharmacognosy and the members, the active members of Pharmacognosy Department who enlightened this seminar along with the Tamil Nadu Dr. MGR Medical University. Well, this program is by the backbone of our dynamic, young, active principal madam, Dr. R. Sendamarai, who always motivates the faculty and the students to go extra mile. We are all tuned up for extra mile. I thank you, madam, at this juncture. And once again, I thank the team of Pharmacognosy members who has made this program a great success. And the hero of this program, distinguished professor and my friend, Dr. Mahadevan sir, who is right now associated with the United College of Pharmacy. Previously, he was with the JSS College of Pharmacy. We have long association with him. Every time you see professor, it's a human approach and also cognistical approach. Because when you see a plant, you can see from top to bottom and you don't see the root. He is the root of the pharmacognosy. You don't see the root. But root has got many functions. Root through xylem pumps everything up and makes it a flower. We enjoy the flower, color, fragrance, etc., etc. But we don't appreciate the root. He is the root of pharmacognosy. Sir, you have accepted readily our invitation. You are joining here, and we are happy to be with you, sir, today. And today's topic in the international seminar is AI integrating the TM and MM. What is that TM? Traditional medicine. What is that MM? Modern medicine. So what is the difference between traditional and modern medicine? Nothing big. Whatever the modern medicine is the extent of your traditional medicine. Think of Resorpin. Okay, from that it goes for the modern medicine. Well, a revolutionary technology as on today, artificial intelligence, as rightly pointed out by our retired professor Raghavan sir, who said that that he has came as a delegate to listen this international seminar. Welcome you, sir. So to gain knowledge, it is not the position, it is not the age, it is not whom you are. Knowledge, wherever is there, you have to come and acquire. Sir, we are really great. We are inspired by your presence, sir. So this particular topic, AITM, எங்க பிரின்சிபல் மேடம் அடிக்கடி எய்ம் அப்படின்னு சொல்லுவாங்க. எய்ம் இஸ் ஆல்வேஸ் இன் மைண்ட். யங் மைண்ட்ஸ், யூ ஆல்வேஸ் ஹேவ் யுவர் எய்ம் இன் யுவர் மைண்ட். Always in mind and keep doing it. As Abdul Kalam rightly said, dream. Dream is not that sleeping and dreaming. Dreaming is what you want to achieve. That is the dream, real dream. So here you should know about the artificial intelligence, which is mainly connected with the machine learning, deep learning, large learning models applied to the traditional medicine, which has got a large importance. Our commitment today contribute to the enhancement of human health directly or indirectly, but we hope it is directly for the commitment of human health. This traditional medicine across various cultures and cultivation and civilization process, wide range of healing practices passed through different generations. So that is traditional medicine. When one generation to another generation carrying out the information, that usually the hidden information. But today books are there, resources are there, everything is open, that only you have to go and acquire it. And after all, acquiring by you in the library, after that, if you don't able to read all the books, it is there comes the artificial intelligence. It will think like you, do like you, and make you better. So the sum of the total skill and knowledge that we require for practices, beliefs in indigenous to various cultures and civilization. So as I just make it myself, artificial intelligence is a simple definition of saying a branch of computer science stimulates human intelligence such as learning, reasoning, and finally decision making. All the three are important. Learn, reason, and decide yourself. So that is rapid progress of artificial intelligence as on today has fueled innovation in a multitude areas, not only in this traditional medicine. In any of the science, AI plays its role. AI plays role in drug discovery. AI plays in role even in cooking also. You want to do something new cooking also, you can go for AI. So it is something, an extraordinary mile, a new innovation where you have to opt yourself, identifying the potential active ingredient or API for targeting pathways, whether it is with the traditional medicine, whether with a single herb or multiple formulae or many herbs at various parts of the plant, whatever it is, optimizing the disease, diagnosis, treatment models, developing new treatment models, which all makes us AI to be very innovative. So you have come all the way, so I don't want to prolong my talk today, that you are going to learn something new on AI, especially with the traditional and modern medicine, which are being totally interconnected. So once again, I welcome you all. As a home taking message, you attend many workshops like this on the topic of artificial intelligence, because it is a new area. You need to know so many details and improve your knowledge. And my humble request to the young generation, keep reading from the books, not from the mobile phones or from the computer or from the internet. Read books. Books really give you the real message, which will make you to more and more think. That's it. So review yourself and discuss. Thank you once again. Thank you one and all. Thank you for the opportunity. Thank you.
Thank you so much, sir. I feel privileged to share a few words about our guest of honor, Dr. N. Mahadevan, Professor and Head, Department of Pharmacology, United College of Pharmacy, Coimbatore. He has completed his bachelor and master's from the Tamil Nadu Dr. MGR Medical University, Chennai, with an exemplary academic record and has received the doctorate in pharmacy in the year 2006. He began his journey as a lecturer at Swami Vivekananda College of Pharmacy, Tirchenur, and continued working at various prestigious institutions, namely JSS College of Pharmacy, Ooty, ISF College of Pharmacy, Punjab, Rajendra Institute of Science and Technology, Haryana, JKK Nataraja College of Pharmacy, Kumarapalayam, College of Pharmacy, King Khalid University, Saudi Arabia, and has been an epitome of great teacher for more than 28 years. He has received numerous grants from AICTE for conducting seminars and staff development program and has received 50,000 Saudi Arabian riyal from King Khalid University, Saudi Arabia for conducting research in the year 2007. He has supervised around 42 M.Pharm research projects and has published more than 81 articles in various renowned national and international journals. He has presented more than 106 research papers in various national and international conferences. He is the member of various scientific and professional societies, namely Indian Pharmaceutical Association, Association of Pharmaceutical Teachers of India, Editor-in-Chief of International Journal of Recent Advances in Pharmaceutical Research, Chairman, Institutional Animal Ethics Committee, and reviewer of various international journals. He has organized numerous seminars and conventions and has delivered countless guest lectures in various colleges and universities. It's an honor that we have been graced with your distinguished presence, sir. I would like to invite our chief guest to address the gathering.
Good morning. Good morning to all of you. Respected Principal of this Institute, Dr. Sindamaran. Respected Vice Principal of this Institute, Dr. Krishnamurthy. All the HODs, dignitaries on the dais, delegates from various colleges, student delegates, and all who are present here, very good morning. It gives me immense pleasure to be here today as the chief guest for this international seminar organized by Periyar College of Pharmaceutical Sciences, for which I am very much thankful to the principal of this institute, Dr. Sindamaran, and the organizing committee members. Thank you, madam. My memory goes back to the year 1996 or 1997, I'm not sure. Here, there was a seminar conductor organized. I attended that seminar along with some of my students from where I was working. I brought some students here, sitting in the audience side, carefully listening the lectures or the presentation given by the resource person. That time, Dr. Jaigar was the principal. From that time onwards, I built some good respect on this institute, The way they organized during that time, the seminar, it was it was got attracted in me. So now I have a very good high, respect to the institute. Whenever I get a chance to come here to the institute, I never hesitate. I visited this institute for a few times as an examiner. I never declined, though I have to come far away, please, to here. Even then also I did not decline because I got that much of love to this institute. I always think very high about this institute. Today, I am sitting now in the upper side, after 30 years maybe around, in the dais, for which I am so much excited, for which I am very, very, very much thankful to the principal of the institute, Dr. Sandra. Of course, for organizing committee members also. I congratulate the organizing committee members for selecting such a very, very interesting topic, very, very new and emerging topic, and forward-looking topic in the seminar. That is the role of artificial intelligence in integrating traditional medicine and modern medicine. You all know that the traditional system of medicine like Ayurveda, Siddha, Unani, and TCM, you may be knowing TCM, traditional Chinese medicine. So these are practiced in different part of the countries, including India, China, Sri Lanka. Of course, there are many countries throughout the world. So it contains a lot of invaluable information. You take Ayurveda or TCM, the text of Ayurveda book, you can say book, or TCM book or Siddha book, there are a lot of important invaluable information is available. Like what is the name of the plant? That plant is for what? Okay, what are different types of disease conditions? How to prepare a medicine from the the herbal drug? Step by step instruction. So these may be available in some books of traditional system medicine books. And these herbal remedies or the herbal medicines, traditional herbal medicines, till now not completely validated. Validation is very important. Validation is to be done scientifically. So that validation is not completed till now. That means we have a chance or choice to validate those systems of medicine. How we can validate? Scientifically validate. But you can use artificial intelligence in validating all those information. The information may be on herbal remedies or a combination of drugs which are used in the form of formulation or maybe a single drug, anything. So that may be validated. It is there in your hand to validate with the use of artificial intelligence. So one is you can validate the traditional medicine, means whatever the claim it is given. The second is that with the use of artificial intelligence, I can discover a new drug from the traditional system of medicine only. So there are a lot of knowledge, traditional knowledge. You take up one, and you can also discover a new drug from the traditional knowledge, traditional medicine, so that it is possible to integrate traditional knowledge with modern science, or you can say you can integrate the traditional medicine with the modern medicine. That means you are bridging the gap between the traditional medicine and modern medicine. So what AI or artificial intelligence will do in case of herbal drug research here? Herbal artificial intelligence that will not replace the traditional knowledge. That is the one which everybody fear. There is no chance of replacement. It will not replace the traditional knowledge, but it will be useful in drug discovery program. That means you can speed up the drug discovery program with the use of traditional knowledge or with the use of traditional medicine. Artificial intelligence can analyze large number of data sets. We call data sets. Okay, so that we analyze that. It's a computer approach, computer program. So it analyzes large number of data sets of phytochemicals, and it will predict several properties of the compounds, like biological activity of a compound, or maybe a drug, means many number of compounds, or it may predict mechanism of action, or it may predict ADME. I hope you'll be knowing about ADME: absorption, distribution, metabolism, prediction only. So this computer will analyze a drug in the sense it's a compound, now it's a compound. So that will be analyzed and it will predict all these properties. Not only that, it can also predict the toxicity. Not only that, it can also simulate the clinical outcomes, whether it may be that the particular compound can be used clinically or not. So these information you can get it from the artificial intelligence. There are a lot of techniques are used in the artificial intelligence, like machine learning. I think you have heard about machine learning, deep learning, natural language processing, and artificial neural network. So these are different terms is supposed to be familiar when you talk about the artificial intelligence. These technologies or techniques if you use, you can screen large number of compounds in thousands, so 1,000 compounds maybe. You can analyze within few hours, whereas the same process if you do with the conventional method, it take around years or more than few years, maybe 2 years, 3 years, 4 years, in years only. But if you use artificial intelligence, you can do all those process within few years, or hardly it may take a few days only. So that much speed it is. That means in a short span of time, with the use of artificial intelligence, you can find out a lead compound, or you can say an active compound. So if AI model is used in the every stages of drug discovery and drug development, there is a possibility to integrate traditional medicine with the modern medicine. This is possible. So here is a gathering of a large number of people. Some may be the staff, teachers, researchers, students, and many. So if we all join our hands together, share our knowledge, share what are the information we have, and working hard to discover some kind of lead or compound which may be having certain activities, exploring the herbal medicine. If we do all these things, it is possible to integrate traditional medicine with the modern medicine. There is an approach, a new approach we call an emerging approach. That approach is recently developed, for which generally the herbal medicine is read in that approach. That approach is known as the network pharmacology. Network pharmacology. Right. So that uses network analysis. You may not knowing the meaning of network analysis. It's very difficult at this stage. Okay. So it uses a principle of network analysis, network pharmacology. Right. So just I can have some important information related to the pharmacology that related to artificial intelligence. Generally, nowadays or currently, a drug is developed by one compound, one target, and modulation of one disease. Understood? One compound having acting on one target, then it modulates a disease. This is the concept nowadays for the drug discovery. Now it's going on. Okay, many people try with one target only. Suppose this is the first scenario, just you can keep it. One drug means not a drug now, one compound acting on one target, that will give a response, means modulation of one disease. Just you can make this as a first scenario. The second scenario, one drug acting on multiple targets, so it can modulate either one disease or multiple diseases. You just keep this as a second scenario. Now we go to the third scenario. Multiple components, several components acting on multiple targets including genes, and that modulate multiple diseases. Out of this, I can say the third scenario in which if drug is developed, that may be the best one. I tell you why it is. I explain with one example. You take cancer. You know, cancer is a multifactorial disease that involves several pathways. If a compound which is used for cancer acting on one target, that compound may become resistant to cancer. Means resistance may be possible. One. The second scenario, you have a compound, you have multiple targets. It may be useful or modulation in one disease or multiple disease. Say for an example, if it is used for single disease, say for an example, in cancer, say that compound having multiple mechanisms of action. So in several pathways it blocks so that the resistance to the cancer is less. The second scenario. That means the second scenario where a drug is developed or discovered, that drug will not have that much of resistance to the disease. It may be cancer, it may be a bacterial disease, means the resistance. But the third scenario, what I told, multiple components acting on multiple targets, that is modulation of multiple diseases. In this case, multiple components are used. Generally, the herbal medicine that contains several components, or a formulation that contains several ingredients. Those ingredients containing several components. So those several components acting on several targets that modulate several disease conditions. In that case, the drugs developed from the third scenario, which may be the best one among this, for which you have to use network pharmacology approach. So if you do network pharmacology approach, you can develop a very good medicine from the herbal knowledge or herbal traditional medicine. You can make a very good drug from the herbal medicine. To cite an example, one example I want to make it. This is a well-known example for you. It's a very known Ayurvedic medicine, Triphala. You know it or not? Triphala Churna? Yes, everybody is knowing it. So Triphala Churna is a combination of three fruits, Terminalia Shibula, Terminalia Bellarica, Embolica piscinalis. So combination of these three fruits, that is called Triphala. So some researchers have taken up this Triphala Churna. They studied network pharmacology, means they studied this drug using network pharmacology. So the final result, just I am telling you. So they were able to identify there are 60 different targets. Targets were 60. Minimum. They found that minimum 60 targets they are able to identify, and these 60 targets modulate 130 diseases. How many? 130 diseases. So, in short, I can tell the meaning is that if you consume Triphala Churna, the form of powder in general, it may modulate 130 diseases, or you can say it may treat, it may be useful in treating or preventing what it may be for 130 diseases, including anti-inflammatory modulation and anti-cancer modulation, though the Triphala Churna mainly used for digestion. So, dear delegates, to encourage you, to motivate you regarding the artificial intelligence, you want to learn more and more with interest, I would like to ask you a very, very simple question. If you know the answer, just raise your hand. If you don't know the answer, I am there. I will give the answer. No problem. Delegates, can you tell me my question? My question is, what is the first drug discovered by using artificial intelligence? Simple question. What is the first drug discovered using artificial intelligence. Your time starts now. If you have the answer now, you can tell me. Be honest, don't check in the Google, don't check in the chat GPT. If you have the answer, you can tell me. Otherwise, I am there, I will tell you. Nobody? No person is raising hand, so you may not be knowing the name of the drug. Okay. I will tell you now, it is a small molecule, the name is rentosertib. I spell it RENTO, rentosertib, SERTIB. So this is the one which was discovered using artificial intelligence. This is the only one right now is available. And this drug entered now in the clinical trial phase 2. That should be appreciated. To your surprise, I can tell one more information is that this particular compound discovered within 18 months, just 18 months only. Otherwise, it may take more than 5 years. So that is the power of artificial intelligence. Within 18 years, the researchers are able to discover a drug using artificial intelligence that also entered, means also entered into the clinical phase 2, and we are eagerly waiting for its update, and it may be available in the market soon as a drug. So this drug is useful in case of lung disease, that is called idiopathic pulmonary fibrosis. Idiopathic pulmonary fibrosis, that is the name of the disease for which till now there is no medicine. So this is the medicine the researchers expecting that may be available in the market soon. So dear delegates, I can tell you the future is AI, only artificial intelligence, and we cannot escape from this technology. We have accepted, we should welcome it first, we should accept it, accordingly we have to act it. Otherwise, we cannot escape from this technology. I appeal to all of you, especially the students community, because they are large in number. You try to discover a drug from this traditional system medicine. There is a possibility. There is a possibility. Say for an example, one more example I want to give you is that Ayurvedic medicine, I told you the variation, that is a big problem, and of course it has rich sources of remedies. You can also use AI technology to identify, or you can develop, or you can discover a drug from Ayurvedic medicine. That's what I told you. Okay, so for which you can use network pharmacology. So that also I told you. Okay, so use any technology like network pharmacology may be difficult right now. If it is done by any means, you are able to discover a drug, very difficult process, I can understand. It is possible, but it is possible now. Always you have to have a confidence in you. I can. You say for 100 times, 1,000 times, even 1 lakh times, you do it until you get some confidence. When you get confidence, you will achieve your goal. You will achieve your goal. Maybe time takes, but it's possible. When you develop or can discover develop a drug, and it comes into the market, that will be a great contribution by you to the society. The whole society get benefited throughout the world. Dear delegates, special student delegates, the theory alone, it's not sufficient. This is my personal feeling. So personally, I feel that the theory alone is not sufficient, not at all sufficient. So what you have to do? You attend any workshop conducted in any colleges to understand better about a concept. Wherever a practical training is given, you go and attend. Wherever a practical type of knowledge is available, just go and attend. So that is the best way, along with the theory, along with the practical, you can learn more and more. Otherwise, you may feel difficulties by studying only theory. So I take this opportunity to request the principal of this institute. Please, madam, this is a request from my side. Please arrange or organize certain workshops or hands-on training or practical type of classes, maybe a limited number of students, so that the students community will get benefited. So they understand more by having the practical experience. Once they understand well, they become the experts. They become the experts. Of course, now they are sitting in the upper side, and you may be sitting on the dais if you become expert, and you may be one of the resource person in the future. It may take some time. It may take maybe around 5 years, 10 years, 15 years, but I am expecting at least one of you become in the future, may become a resource person, sitting on the dais as a guest of honor or guest of chief guest or whatever your position, for which you need a lot of training. That training should be given by us. So I request our madam, principal madam, to arrange such kind of workshops and hands-on training. It's a practical type of workshop. So with this small request, I conclude my speech by saying, make your future bright with the artificial intelligence technology. Thank you. Thank you so much.
Thank you so much, sir, for sharing your insights about traditional and modern medicines, about artificial intelligence and drug discovery, sir. As you have said in your speech, the Triphala Churna can cure about 130 disease. Similarly, with your one single speech, you have covered multiple informations, and we are excited to listen to your upcoming session, sir. Thank you so much, sir. A silent isn't much use to anyone. Hence, I would like to invite Mrs. M. Shanta, Associate Professor, Department of Pharmacology, to express our heartfelt gratitude by delivering the vote of thanks.
Very good morning, one and all gathered here. I deem it a great honor to propose vote of thanks on this special occasion of International Seminar on the role of artificial intelligence in integrating traditional and modern medicine. On behalf of Periyar College of Pharmaceutical Sciences, first and foremost, it's my honor and utmost duty to deliver a sincere gratitude to our chief guest, Dr. Mahadevan Sir, Professor, Department of Pharmacognosy, in my pharmacognosy and College of Pharmacy and Coimbatore for accepting our invitation and inaugurating this knowledge sharing international seminar. Thank you, sir. And I also invite Dr. Raghavendran sir also. Thank you, sir. I take this opportunity to thank our principal madam for your unwavering leadership and dedication towards our institution. Your vision and guidance at each and every step have been instrumental in making this event a grand success. Thank you, ma'am. My special thank our Vice Principal Sir for your continuous supports and valuable comments in improving and organizing this program. I extend my sincere thanks to all the head of the department, teaching and non-teaching faculties of your timeless efforts in organizing this event. Your hard work and commitment are truly commendable. Finally, I would like to thank our delegates for participating in this event, making it a grand success. Once again, I thank you all.
Thank you, ma'am. Now let's start our starting break and gather again towards scientific. I request the students other than the delegates to return to their respective classes. spread to easy them. Phenomenal.
ஏமா இத்தனை இது அதில் மாட்டி வச்சு
May I invite Dr. N. Mahadevan, Professor and Head, Department of Pharmacology, United College of Pharmacy, Coimbatore, to deliver the lecture on artificial intelligence in herbal drug research. I request all the delegates to listen intently and maintain silence throughout the session.
Respected dignitaries, delegates, student delegates, and all who presented here, once again, a very good morning. I take this opportunity to thank all the organizers who introduced me with good words. I am so much excited to see such a very large crowd, a beautiful crowd. By seeing you, I can understand that you are very eagerly waiting for the session on artificial intelligence. Dear delegates, nowadays, many people are talking about artificial intelligence, but many of you, especially the students community, they are not knowing much about the artificial intelligence, or they may know only little about the artificial intelligence. You take the artificial intelligence technology, it is used in different fields. You name any field, there will be a use of or applications of artificial intelligence. It may be medicine, engineering, pharmacy, agriculture, or you take any field, there are a lot of applications of artificial intelligence. So now I am going to talk about topic on artificial intelligence and herbal drug research. That means I'll be talking much about the application of artificial intelligence in herbal drug research. So as I told you, there are only few people know much about the artificial intelligence. Many of you are not knowing much on the artificial intelligence applications, especially on the herbal drug research. அது எப்படி தெரிஞ்சது? செய்திருந்தது. Delegate artificial neural networks, random plus so many. So unable to, we are unable to understand all these terms, however, at least you know all these terms that are useful very properly artificial intelligence. Now, I come to the artificial intelligence. Short way. So when you integrate artificial intelligence in the Harvard research, that means if you do the Harvard research with the use of artificial intelligence, there are a lot of variables you take instead of several promising applications. So that the Harvard research field may be transformed, change models, use AI technologies such as machine learning, deep learning, along with several other fields that can be implemented in different stages of drug discovery and development. Drug discovery and development are a lot of stages. There are a number of stages. I complete. So every stage there may be used various. There are several artificial intelligence techniques. You can apply all together or maybe any individual field. So there may be a possibility of performing drug discovery development and maybe a short time without spending much money. AI technologies that help overcoming certain problems in the traditional challenges in drug discovery development. So when you do the traditional way of drug discovery development, like you have to spend a lot of money and it takes a long time. But when you use artificial intelligence, you can you will be spending less money and within a short time span, you are able to discover a drug. You can also develop a drug. So this is a very basic only, and the applications of artificial intelligence in the different fields. Like as I told you, the artificial intelligence is applied in the various fields. After those fields, the purpose industry is the first vulnerability means we apply artificial intelligence in the drug discovery program or any industry. There are lot of variables. That means lot of variables are there when you use artificial intelligence be pharmaceutical industry. As I told you, the artificial intelligence technology will be used in drug discovery or drug repurposing, create trials, or any drug discovery process where the artificial intelligence. So when you use artificial intelligence, there are several advantages. You can reduce the workload of human workload. So human workload is reduced. There will be chances of finding errors, human errors required. You can achieve the target with the skills the short span of time, short period. You can achieve what you use artificial intelligence to drug discovery. When you use artificial intelligence, it makes the drug discovery development or validation of practices faster, more efficient, and more. So these are different advantages to use. Artificial intelligence is the drug discovery. Right. So then just we want to give some of the applications of the drug discovery. So these are very cases only. So this AI is useful or it can be applied in different ways in our drug research. Right from cultivation of medicine plants to the drug discovery program and to post-market surveillance of pharmacovigilance, almost similar. So you can use any stage or any area in which the application means the game that we provide to make so just we read the applications, maybe more than this make available. Calculation of its which AI can use. You can identify, you can authenticate the plants by using AI. It may be useful in case of quality control of medicine. You can integrate traditional knowledge with the modern medicine. That is our second topic, right? So it is possible to integrate traditional knowledge with the modern medicine using artificial intelligence. And there are literature study you can use artificial intelligence there. Of course, I told you drug discovery program, drug discovery, drug development, which artificial intelligence, technology is used. It is used in case of drug efficacy. It is useful in case of network ontology. That's what I told you in my address. It is used to make intelligent patient drug. That is personalized medicine. I have a medicine that is for immediate patient. So that can be possible in the case of artificial intelligence. The artificial intelligence that can predict drug extraction. It is possible to optimize an extraction process. It can be the water extraction process or any other extraction process for which AI may be used. It can predict the clinical trial outcomes. Of course, it may be useful in case of post-market surveillance and evidence. So not only this, there are several other applications within the pharmaceutical or industry already carried research. So here so just start with the application of artificial intelligence in the application of research. So it may be very close to the agricultural sector. However, it may be useful when you do the herbal research. Plant, you identify it. Yes, then you can cultivate plant. So you can use artificial intelligence in the cultivation of plants. So how? So optimizing cultivation. There are certain AI models that are developed that can analyze environmental data like climate conditions, soil conditions, water, sunlight. Based on these analyses, it may give the cells in which condition the plant is. So this is the idea of the prediction that is given by the artificial intelligence. We get all this data through the computer so that we can identify what kind of climate conditions required to grow particular. Not only that, artificial intelligence powered systems that can monitor the plant health. It can monitor plant health. It can detect the disease at the early stage and optimize resources allocation like water and maintenance. It means it can detect the disease. It is possible. If you find the disease, means if you detect the disease earlier, that is the treatment will be given to the plant so that you can grow the plant. Of course, allocation of water fertilizers, water irrigation is also problem, and fertilizers that is also problem to solve. These use a prediction. It can analyze soil conditions and recommend the right amount of fertilizer or the type of fertilizer to be applied. So it predicts what kind of, so what is mean of fertilizer required and how much is required. That means which area more of fertilizer, which area less of fertilizer, which area more water irrigation, which area less water. So these information which will be given by the computer system only accordingly we can by predicting optimum harvest time. This artificial intelligence can surely reduce concentration of that is active constants. So of course you must know that when we harvest, the plant should contain maximum productive active constants. That's a good product. So if we want to get a good product value through the artificial intelligence technology, it will suggest or predict which values are that is so that you can pick the plant. So in this context, I can tell you that
தெரியாது சார்
he developed a model for irrigating water irrigation system. He developed. The purpose of saying that is that he can also develop. Is possible, same for you. So that was done, and I should appreciate you The next is the identification and verification of medicinal plants. So usually, generally the scientists they do the projects. In such cases, we have to identify the plant. Usually, what we do, we will cut the plant, take the botanical secretary of the plant or any other person there, we go there, analyze the plant, and we get approval or certificate from the authorized person. So he will check, he will compare with the herbarium, he will make some addition, and finally he will give the certificate. In speed, if you have hospital technology, you take a picture of the plant, it will give you all the plant names. Though it is not up to one, but however, it will identify. So such system is available. That is available in your login. So it is available. So artificial intelligence can overcome the identity problem of the products. Suppose the product is not a plant, it is not a plant. It is a part of the plant. Such cases how to do it. So this artificial intelligence technology, it will generate some kind of pattern so that it is able to identify all the patterns. Only with the leaf is possible to identify, or only with the part of the plant is possible to identify with the leaves. And this artificial intelligence enhances speed and accuracy identification of products. That means speed, short period, in 2 seconds we are able to identify all the patterns. Okay, and this is more accurate. Sometimes there will be given error like, but when you give the proper data to the computer system, that will give the exact accurate and the error. For which different techniques we use. Here, convolution and neural networks, CNN networks, so that's we use that analyze the images of the mass accurately and adding the spaces even though there are small differences. If any differences, small differences here, that cannot be identified by human being, that will be identified by the artificial technology, so that this technology identify and detect adaptation possible there are several mobile applications related to the identification of maps that are available. There are few popular ones I listed here. Is Picture This is the one, and TrackNet, LeafSnap, Flora, Incognita, LandSnap, and other these are the mobile applications. You can download this app in mobile, and that with just is possible to identify all the patterns. So normally our students have another application, this is Google Lens. From that they are able to identify patterns in many techniques. So let us see how artificial intelligence is used. So one of the parameters important is the identification of the when you identify a plant properly and you are ensuring that it's not, this is a part. So AI provider image recognition system are transforming already proposed applications by ensuring authenticity and safety of products. These image recognition systems accurately identify the curves by analyzing visual features. So you analyze visual features like color, texture, shape, or any other feature. You will analyze and you will detect any small particles, they will be and it identify and it can tell the purity of these. That means you detect variation or any alternatives which may be there. That means generally the high value of food that we are having with a similar substances. Even that also can be identified with of artificial intelligence that is part of so that the artificial intelligence makes sure that only the pure product that is we consume. So we are safe. Next application is integration of traditional knowledge with the modern science. during my speech. The artificial intelligence technology marks traditional system of medicine tests like oil and text which Google research area. Idea of data, oil, level, sitter, inorganic, museum, traditional Chinese medicine books, just you can make a understand. So these technology marks these books, finding patterns and validate appropriate analysis. There is a technique and artificial intelligence called taxonomic processing. It is used to extract several remedies, symptoms, users, name of disease, and storage from the ancient texts or even modern texts. The same NLP that can translate complex Sanskrit Bible text into more accessible language like English or Hindi to the North Indian people generally translate Sanskrit books so they would understand. So making them understandable to a wider audience. So a lot of people know what is given in these texts. So NLP tools can identify which has a recommendation diabetes, not diabetes or any other disease, so that they can check whether those herbs are thoroughly scientifically validated by the models. So these information we can get it by the same artificial intelligence. So here I can give some common databases, the scientific databases. It is useful for the students who will be doing the research project. For any research, we use some databases. For government, science fair, scholars, scholar. No, it is very easy and all of you going it, but some students they may require all this information for their project. There are 9 based on different databases like Agrolet, and there is that use of databases. You cannot get well on this database, where in the database you get the vital key and environmental. And there is an Indian database, it's called IMPEA. That is Indian Nutrition Plants, Phytochemistry and Laboratories. So this is an Indian based database where you can find out the nutrition plants and the plants. And there are a lot of other also. You can find it, but I will go through this request. There are EA tools available for the research or the review. The review research guide, ARISIT.org, connected. So these are the network and chemical biological activities like how we can calculate and do research using artificial intelligence for drug discovery. We use to check in this PubMed or this. There is another database, and this is also very important for AIMS research. Drug is very important for target prediction, dogging, etc. And there is one more called AIMS species database. So you do not use all the databases, but you can use some of the databases depending on the research. Now, I have come to the important application of artificial intelligence, drug discovery and development. Drug discovery on land using different AI artificial intelligence platforms. Artificial intelligence applied at different stages of drug discovery. So it is used in every stage of most in drug discovery. So just by telling you the stages, selection of drug species and how to the collection of phytochemicals and data, sample structure organization, and the complete guided revision and see in short use. Target prediction using AI models, using different AI models, some predict the targets, monitor targeting and guiding. So after target prediction, you have to go for the market target target. Once these two are done, then you should find the AD of the particular compound, absorption, distribution, metabolism, and excretion properties of the compound. Then the toxicity study. I tell you what the factor would be used later. Then there is a missionary program. There are missionary program that is called QSDR, structural activity equation. So that we did. Then in finding the acute and finding the need compound, that the compound may be treated to right. Once you identify the lead drug, that should be set for in vitro and in vivo studies, where you optimize the lead, taking some structural modification. Then that proper quantity is most developed that can be further developed by reaching and by this is the same only, same thing only. Just I tell you further, tell you how the traditionally of the discoveries. What you have to do, select a plant, then you authenticate it. You authenticate it, you can extract the plant odor. You can extract the plant odor with super solvent, water, alcohol, any other water with solvent. So you are getting the solvent extract. The solvent extract may be settled for biological screening, or the plant extract may be further settled for fractionation or isolation. Again, either fractionation or isolation compound is for biological screening. However, you may be getting a pure compound of isolation. This pure compound again is for biological screening or toxical screening, or and this pure compound is to be means the structural compound is to be identified. That's called structural speciation. Then you can go for synthesis of this structure. What are the compound structure that is to be chemically synthesized. Once you get the compound, when you know the structure, you can make some modification of structure. That is molecular modeling and in silico screening. You make some modification of structure, post scaffolding cost, and the structure modification will be made, and when you are asked again you go for this. Again, molecular target prediction, docking, and you will be you. And okay, so traditional way to make it is lot of time. So this is where the development is very common for the traditional way and the artificial intelligence both the same only. First we have to go for in vitro studies, then clinical trials phase 1, phase 2, phase 3. Then it must be every approval of PSA. Then if it supports that it can arrive to market. Even it is arrived to market, then post market certificates pharmacovigilance statistics. This is the normal way of performing drug study in now, as just a comparison, when you do traditional way of drug study, or when you go for artificial, when you go for finding new components, drug study from the artificial intelligence assisted drug study, just in comparison, here you see the left side. So the traditional drug development of drug discovery process. Here, A state drug discovery process on blue lines. So if you take the number of years, it takes around 2 to 5 years for finding and validating the targets. But when you use artificial intelligence, it takes only 1 to 2 years. See, here all the time is short, here all the time is. So an average of 14 to 15 years, or sometimes 60 years, sometimes before 20 years for developing it. By traditional method, where if you apply artificial technology, you can reduce the time to very fast. It may be around 80 to 90%. So that which regularly reduced by the artificial intelligence. So this is the one point. Second is, you see, the success rate in case of traditional way of that is very low. Here, success rate is very high. Time consuming, the traditional way, where the faster development is possible. Short time, the cost associated with the drug development, drug discovery, in case of traditional drug development is very high, where the cost reduction in the artificial intelligence is the so from this slide diagrams, it will be difficult to follow because these may be new to you. However, this is the way I will present the evidence. We call the target prediction. Target means the biological molecule on which the drug is acting. That is, that we read first, then you can understand. Target prediction is meant to involves identifying specific biological molecule. It can be a enzyme, a hormone, any other biological molecule. Then in which the compound can interact and produce a biological. And then one side you are having the compound and you have a target. So whether the compound is acting on the target or not, that will see through the computer not extremely laboratory, it is the computer. There are lot of platforms available. No problem. Okay. So this is an important piece there in drug discovery that helps determine the compound's mechanism of action. We can also find the mechanism of action in the target prediction step. There are several softwares available for this. That detect the target activity prediction and from structure based, ligand based target technology is available. While no method of that it has to be used. So sometimes people ask which method is best. In case of structure based or ligand based, we cannot say that best. So not about this also. Every method has its own strength and benefits. So here I can give you more information regarding the ligand based or the structure based target prediction. Here can be for key molecular targets providing value to say the mechanism of action. Two different approach. Ligand based approach. Ligand based is small molecule, giving a small molecule that we targeting the biological. So use information to structure is done about two targets. So here what the use we will collect the data from the databases. Whatever the one which is very similar to the inquiry molecule accordingly give the answer. So it will give the target for which chemical similarity should be. Compare the structure of natural product to the known ligand. So this is a way to do it. And the different tools that can be used. So one of the best tools which I have used is the Swiss target prediction. This is a tool which I use. There are other tools also like similarity and similarity tools. These are all other tools that can also be. Is it audible to you? I think mic is not working. The second approach is that pharmacore modeling. So this comes under ligand based approach only. Pharmacore means just see any feature. So in this case, any feature is responsible for activity like how many hydrogen bond donors, receptors, or hydrophobic leading, etc. So this is known as pharmacophore modeling, which comes under the ligand based approach. Next is structure based approach. Structure means protein interaction. So in this, the technology is a 3D structure. Here, molecular docking that should be done with the use of Autodoc, Swiss doc, or any other tools that we are available. So all the computer-based approach. Then the network is here the compound target And this is interaction, this is also available in the artificial intelligence technology. And I told you much about the network pharmacology in the morning, my address, the same thing also. So it's a different technology, but it comes under AI only. You use AI in network pharmacology that predicts multiple targets called pharmacology, of course, a part of pharmacology and the pathway efficiency. For this, you can use different tools like cytoscape or next is the molecular docking. This is to be done with the computer only. You not spend much time in your laboratory. You can do in the computer only. So molecular docking is a computational technique. The computer can do it that predict preferred binding orientation. Orientation means pose, different and standing in this pose. I'm standing in this pose, just like if I turn another pose, if I turn another pose, like that, the chemicals also have different poses, and in one pose it will bind a particular molecule, and that will be fine. So such kind of orientation is possible. So binding orientation of small molecule with the target to be right. It helps us in estimating the binding affinity and interaction that is useful, much useful for drug discovery and drug research. There are a lot of steps in the molecular docking, like ligand selection, then target protein selection, preparation, active site identification, docking protocol selection. There are so many other things, and finally, validity of the docking. The same thing is given here on flow chart, so I did not again read. Here, to make an understand well, I can give this one. So this is a ligand. This is a ligand. This is a protein. Okay. So when you dock, the ligand go and attach to the biological molecule, maybe the target like this. So that is, you can say, some software is there where you can visualize such kind of interaction. So when you do the research, when you do the docking, you'll be getting a picture like this one. Now, EAD. So this I told you several times. This is the one which will tell the property of the compound. Absorption, distribution, metabolism, excretion, and the T that indicates toxicity. Or toxicity you can do is separate test. The pharmacokinetic safety property is essential to success of the potential. Means you have to make or you have to modify a drug system that will be having the optimal AD-MDT property. So that is the one that can be developed to be a lead and manage the So this again I did not tell you because already told you about suspicion property. So the meaning which is given here, I think it's not required for you. So what is the role of AD-MDT in drug development? Why you have to do AD-MDT? Why? It's an in silico prediction. If you predict it properly, there are a lot of compounds which is not fitting to the AD-MDT property that can be filtered out. So those compounds which is not good, that can be filtered out. Only good compounds. Good compounds in terms of pharmacokinetic profile. So those compounds which show a good pharmacokinetic profile that can be selected. Remaining can be omitted, rejected, or filtered out. So that we can optimize only the lead compounds. So modifying structure to improve AD-MDT property. So there is a compound. Still, any modification required that can be modified to fit into that pharmacokinetic process. Then that compound will be sent for the clinical trials, pre-clinical trials, and later on clinical trials. So that is developed here. So what are the importance of AD-MDT? That I already told you. So it reduces the failure in last stage. Late stage failure that can be avoided if you do the AD-MDT property at the earliest level. Improves drug safety and effectiveness. It also ensures the regulatory compliance. And there are methods used the computer method only. used to predict certain parameters. Lipophilicity of the compound, how it should be. What should the solubility of the compound? What about the oral bioavailability is taken orally? Whether that compound crossing the blood-brain barrier or not, it crosses what happens, if not crosses what happens. Whether it can inhibit CYP450. What is it? Cytochrome P450 enzyme. When inhibited, what happens? So these are different ways that is predicted by studying the ADME property. Thereby we can make a drug candidate, a lead candidate. We can identify the lead candidate that may be developed here. So here I give some range. The range always changes depending upon the the research requirement. So though the ideal property you see here lipophilicity of the compound approximately it may be okay. If it is log P value is 2 to 4, it may be a good compound. Though up to 5 is okay, 0 to 5 is okay, still there is optimum lipophilicity is given or suggested by many researchers. There should be between 2 to 4, sometimes less than 4 also. Then solubility. Suppose a drug is highly soluble and highly permeable. This is a drug which is more suitable for water administration. There are other properties that influence on this. Oral bioavailability, it should be more. In case of metronidazole or some other type of compounds that is having more than 90% of oral availability, that is also to be checked. Blood-brain barrier (BBB) penetration. So antidepressant medication should penetrate little bit. So then only it will be active. Otherwise, cannot. Suppose any drug you are making to enter into the brain, that means that compound should cross blood-brain barrier. So there are a lot of interesting points. Everything should be noted. Whatever may be the problem, accordingly you have to make drug design. So these are some common tools that will be useful in predicting ADME property. You need to have a Swiss ADME that is available freely. It is available freely. You can use it. ADME lab, and there are so many other things around as well. And here, toxicity. Toxicity means is what useful for prediction of the toxicity, whether the compound, invisible compound that is having toxicity or not, that can be predicted. Outcome. So the integral survey, drug bank. You can get the protein structure from drug bank. So there are a lot of softwares, online tools, everything to be used for making drug discovery. In silico toxicity, I already told you toxicity prediction. You can use Protox. There are different versions. We have used personally I have used Protox 3 web tool for identifying the toxicity. So in silico toxicity is highly evolving as integral platform for prediction toxicity of chemicals that could be harmful to human, animal, and even environment also. So what are the drugs that may be harmful to environment? That is also can be identified by in silico toxicity experiments. So if you do all these, you can minimize the need of animal testing, extra stress that may minimize the cost associated with the drug development and drug discovery also less. So these computer-aided drug design or in silico study of chemicals much important, so that you can ensure the safety and efficacy of the compound. So there are toxicity, it may be hepatotoxicity, neurotoxicity, chloride. These can be detected by artificial intelligence technology. Use again platforms, web tools. It is possible to find or predict all these toxicity. So here I can tell you some of the platforms that will be useful. Protox 2, Tox 3, where now is Protox 3 is available. There we have done some work to find out and predict here toxicity and other toxicities. Then de novo compound optimization. This is another part in the drug discovery program. So here de novo compound optimization in natural product sector, computational design of novel molecules, which is inspired by the naturally occurring compounds, with the goal of improving the design properties for drug discovery. So there is a natural compounds available. That compound structure may be slightly modified. That modified compound may be having good pharmacokinetic property. If it is having good pharmacokinetic property, that may be developed here. So this is some modification. So there are machine learning programs that will generate new chemical structures also, and this is also possible from the natural phytochemical scaffold. Scaffold means simply I can say it's a core structure like endonucleus. Just I want to make you understand. You take endonucleus that you consider as a core structure. You can make lot of modification in the core structure. Just you can think like that. So that is the meaning of scaffold. Then we optimize the ADME properties, other pharmacokinetic properties. Again, do the prediction, docking from the beginning. Then you will get drug from the drug which is made by the Nova. So here also certain approaches are given: structure-based design, can design, and fragment-based design, etc. So these are very unable to understand even for me also. So just give this. There are different way of doing it. Can give this one. There are different steps are given. You have to identify the need, do the structure analysis, need design tools are available. Use of that, and take a modification of the compound. Again, go for the virtual screening, means prediction, docking, etc. Then again optimize the compound which is most level. Then for that, you consider the ADME property, and that compound will be chemically synthesized, and that will be read here. There are a lot of tools available for making this kind of synthesis. So IBM RSN for chemistry. So this is the one which we are told that can be used. So AI tool that can be used for synthesis of compound. Here, that's the word AI-based retrosynthesis. Retrosynthesis means a big chemical structure is there. Just you can make disconnect the different bonds so that becomes simple one. From the simpler one, again make a forward synthesis, which will be suggested by the this online tools. So you can have lot of online tools for the synthesis prediction, OSCOs, AI Sync Finder, Chem Planner. There are so many which are available that may be useful in making structure of the compound. Now, drug repurposing. The name itself says repurpose, new indication. So this is also an application of artificial intelligence. Drug repurposing can cause repurpose both the same only. Means finding new indications for existing drug. Already a drug is existing, it may be approved drug or maybe in the investigation stage. That drug may be analyzed with the use of artificial intelligence. A new indication may be identified. So that is known as drug repurposing, for which artificial intelligence may be used. So when you make drug repurposing, you will save a lot of time and a lot of money, because already all the data are available. Data sets all the maybe molecular data, EMS data, all physical pharmacokinetics are already available, so that you can save a lot of money and time also. If you do the repurposing of the then AI may be useful in mass spectrometry data construction. Suppose a molecule is there, if you want to know the molecular MS data, necessary. Problem is A. What is your aim?
Audio.
What we are going to do? What we will observe specific on? Accordingly, you can for the literature. So it took for us maybe more than 1 month. I decided I had to work on a compound which is easily integrated easily isolated. That is spelling mistake here. That is spelling on manipulated mistake. Not manipulate, this manipulate. The next slide is the manipulate. Here one N is missing spelling mistake, right? Manage. So we selected this mode to make some kind of
கேமரா எல்லாத்தையும் பார்த்துட்டு இருக்காங்க.
So this is a naturally very example like
என்ன தெரியல அந்த போன் வந்து
so the menu free name is menu structure of the menu like then. So through the literature we got the structure and a lot of other information. Inside I can tell you because you can also get the. Then we done the corporate church. Okay. So while doing corporate church, lot of information, whatever available in the corporate. We got it. So we got the information like this. One is the different planning, other name, and the compound ID, molecular formula, molecular weight, molecular identification of name, science. It may be new to you, science, it may be new to you. Science means simplified molecular input line synthesis. Common we have to get science structure. Based on structure, computer generates some line like this or cement. This cement is a computer readable format. It is a computer readable format. And what is this? International Medical Identifier. We call that INCH. So these information get by making a literature. Then this compound was studied using space comprehension, taking a five diagram like this. Here you can understand different colors. So these are the basic see. Tiny. That means that compound is having carbon kinase 26% mostly. Then there are other percentage given with the different classes of target. So target classes. It may be kinase, enzyme, protease, depending on the color, you can check the compound acting on which kind of target. So that is it. Then third is docking. So docking study we have done it. We got a result like this. From this, lot of information we can collect it, and for which you need a guide. The person who is good in docking, we can ask what kind of interpretation that can be done. So it's not easy to maybe explain or reading by yourself may be difficult. You ask a person who is very good. Maybe your classmates or your teacher, or maybe you get some information, then docking repeated. So once docking is done, you get your protein structure and the compound which is having binding affinity towards the enzyme or any biological target. It may show like this. Maybe in a different way, it may show like this. That can also be visualized in a different way, different pose, etc. You get like this. And you get ADME results when you use Swiss ADME tool. You have to use this one. you get ADME properties like this. Can you see this one? What is the color of this? Inside. What is the color? Black. I could see this was a pink color. Is it pink color or different color? Another way, pink color. Pink color. Yeah. Right. See here some lines drawn like this. So when you make the ADME property, you can means the computer generate a structure like this, and there is a pink area, pink colored area, and you get a line like this. May be different for different compounds, different lines you can get it. Here polarity. So this compound nature extending for the polar. That means this compound is having more polarity. It's not within that pink color structure. That means this violating this property. There are a lot of properties. Properties are there. So any compound which is good in the pharmacokinetic property, that should have the lines within this pink lines. Pink color one. If any extension that gives that is not good, that is violating in this structure that is violating in terms of polar. That means this compound show more polarity. So we want to make some structural modification, improve the electrostaticity, or we want to reduce the polarity. That way it's possible to make another compound, another analog. So that compound we want to test it further. So to this compound this study, we stopped by making prediction of the toxicity. Then we want to try with a different structure this topic. So toxic study that we found means we planned that how the toxicity goes for this tiny brain. There are different prediction. There are different process. This one predicted toxicity falls under the class code. That means safe. No problem. This manganese is safe. So that could be identified. And its predicted LD50 value was found to be this much 1190 milligram per kg. It means it's a very safe one only. So this much we studied. After that we stop. I told you because of we want to make some different structure. So this is the way a compound will be identified with the use of computer and the use of artificial intelligence technology. So sometimes it feels easy. Sometimes say that gives lot of trouble, lot of problem, and even after 6 months also, we cannot improve it. So it's an interesting one, good one. Okay, sitting in front of the computer, it's possible to do many things. Only one problem is that you cannot have much time because you're studying. Your studies are also very important. You cannot spend a lot of time only with this, but you can make small projects with use of this. Further, you can develop when you go for your higher studies, and you can also become expert. Once you become expert, of course, I can say I can make anything, right? So the future is the artificial intelligence only. Our future will be filled with artificial intelligence technology. That's what I told you in the morning itself. You cannot escape from this technology, and we should accept it. So thank you. Thank you so much. Now, I know no questions. If you have any question, yeah, welcome.
The delegates are welcome to clarify the doubts if they have any.
See, sometimes I feel myself that I am giving liquid advanced which we don't know anything. Our syllabus is in such a way. This is right. I am not finding any fault with you, but our syllabus is so the level. Okay, so when compared to that, you know, but this is going to come in the future. And I prepare this presentation at your level. Students level, I know what are the audience. Audience is most of the students only few staff maybe mean that also is very difficult only. So when keeping all this in mind, I prepared at your level only. But if you go for higher and you cannot understand anything and you feel boring also and you may feel no, you feel yourself you are very very low. So that is the reason it should be applicable to you. At the same time, it should not be very very high level. That kind of prepared slides. Of course, still we are unable to understand. No problem. Just you can go through the Google slowly. You study, you can understand what are the information input I gave. You can slowly understand. Okay. Especially the student delegates, if you have any question now, you can ask me. Still, if you want to ask any question in the future, you can also ask me. You can contact me. Hold on. Enough. So thank you so much for your listening, and wish you all the best for your future. Thank you once again.
Thank you so much, sir, for the insightful remarks about the role of artificial intelligence in urban research. Even though there are many AI platforms available nowadays, mainly they are using for drafting mail and completing assignments only, and it is truly affecting the critical thinking and creativity of everyone. So I hope this session would bring a change in all of us, and we can try to learn about the AI tools mentioned by you and apply thereafter. Thank you, sir. Please maintain silence.
Hello. Hello.
அன்மியூட்ல தான் இருக்கு மேம்.
Unmute learner. Huh? Yes. Hello. Hello. 1, 2, 3. I'm audible. Yeah.
வாய்ஸ் வரல மேம்.
இதுலயும் வரலையா? இதுல இருந்து போகுங்களா?
எதுல சார்?
லேப்லயும் போகுமே.
போமே.
ஒரு தடவை பேச.
சார் வாய்ஸ்
Hello.
கேக்குதா?
Am I audible? Am I audible? Yeah. Fine. Right. Yeah. சரி. இதுல பண்ண முடியும். சேஞ்ச்
பாயிண்டர் அப்படியா? அந்த பாயிண்டர் தப்புமா?
No problem. Yeah, fine. The pointer will work here. Slide changing.
ஸ்லைட் சேஞ்சிங் அப்படியே. சரி.
Yeah.
It's time 12 minutes. May I request Dr. Ishwan to honor us by a morning testimony. To hear the teachers.
Thank you so much for having me here. And the next 1 hour, it's 1 hour. Please put your maximum heed to understand what is Gen AI. And I'll give you a real world scenario how you can apply Gen AI and also take some important vocabularies which I'm going to deliver to you, the use case, which you can search after some time and try to identify all these aspects. The first slide itself, you can able to see the big umbrella of artificial intelligence. Inside this big umbrella, you can able to see the machine learning where we won't be using any neurons. Right. Yeah, please. Follow me. Yeah. Am I audible? Please listen to me for 1 hour to put your maximum key, and I'll also give you some live demo on the code which we have generated. Try to understand some of the vocabularies and try to understand what I say. Okay, it's a very competitive field. So artificial intelligence is a bigger umbrella. Inside the bigger umbrella, we have machine learning where we won't use any neurons. First and foremost, you need to know what is neural network. Then only you can able to understand whatever we speak, artificial intelligence, generative AI, all these things. Neural network is a
mathematical craft of our neurons. நம்ம மூளையில எப்படி நியூரான் இருக்கோ அதே மாதிரி we have defined, the scientists have defined the work of a neuron in mathematical model. So in machine learning we don't have any neural network. We don't have any neural network. Whereas in deep learning we have neural networks. So what the deep learning will do is it will try to collect the information, it try to synthesize the information and produce a meaningful results. Whereas in machine learning, we have supervised, unsupervised machine learning that the previous speaker have dwell little bit deeper to it. So I'm not touching the machine learning because it has unsupervised, supervised, and it don't have any neurons. So it's not having brain. So we are moving more towards the model which has a lot of brain, that is deep learning. Deep learning has neurons, so it can analyze. But the core is generative AI. By using this information, if you are able to generate new things, that is called as generative AI. Got it? So I'm going to speak on generative AI and how we implemented those generating AI in drug discovery. Is it fine, sir? Yeah. How we use this in our machine learning approach and how we end up with a new molecule. I'm going to take you through this journey. Got it? Artificial intelligence is a bigger umbrella. Inside we have different features, machine learning, which don't have neural networks, whereas deep learning, we will implement neural networks. Neural networks are nothing but neurons. Okay, if we make the neurons to synthesize new information, that is called as generative AI. Got it? That is called as Gen AI. Now, almost all the companies are working on Gen AI. They have just stepped much beyond to create something called as agentic AI. We'll explain you about all these things if you are interested at the end of the session. Got it? So, yeah. So we'll see about the past major challenge of the drug discovery. This is a major chunk, big challenge. Okay, it takes 10 to 15 years to develop one drug. These are the stories you have often hear, right? 1 to 3 billion average cost we require, 90% failure rate in clinical trial. Patient have to wait for decades for the treatment. They have to wait for a long time. The picture very well specifies they have to wait for a long time. Got it? See, these are the very broad term of the problem which exists anytime and every time. Right. What is the traditional drug discovery does and what is the bottleneck of the traditional bottleneck of drug discovery? So we were speaking, we do virtual screening, all these things, screening millions of existing compounds. How many compounds exist in this chemical space? Chemical space means the huge volume of the chemical data. Chemical space na eppadi நம்ம space சொல்றோமோ அது மாதிரி we have chemical space. How many molecules are there? 10 to the power of 60. 10 to the power of 60. You have to add 60 zeros after that. 10 to the power of 60 possible molecule combinations are available. Is it possible to do virtual screening of all these molecules? It's absurd thought, no? But what we are doing, we do virtual screening, right? So we have to change our mindset from there. And if seriously a scientist is having large computational support and he is doing all these things, which scientists can only test 1,000 compounds per year, including in vitro and in vivo data. Beyond that, they can't test. Got it? So it's a humongous data and the humongous taking of time. So it would take longer than age of universe to explore the total 10 to the power of 60 compounds. Right? What is the solution then? The solution is here. That's the AI revolution. We can design a molecule from the scratch. From the scratch, we can design the molecule. I'll show you how we design the molecules also from the scratch. So it's a kind of a live example where you can put all your practical knowledge. So AI can generate novel compound with specific properties. We can define the properties. I want this property. So it will design the molecule and give to you. And we can synthesize the molecule as well. Like AI for text and art. So you are using ChatGPT, it is on the transformer model. I'll come to what are the models which are available in AI. So you can generate text, we can generate art, but for drug molecule, yes, we have developed a model and AI become a master chemist now. No need of chemistry teacher so far. It's problematic, right? So AI can become a master chemist now, right? So I'm going to take you through the journey today. What's our laboratory, what we did in our laboratory. So we have completed AI-powered drug discovery pipeline. How it starts? We trained our model on 16 million compounds. Okay, I will tell you why we trained on 16 million compounds. Then we made our models to generate thousands of novel compounds and added computational advanced filtering and validation. And finally, we have got a promising real candidate for synthesis. We have synthesized also, we have checked. That data I didn't include, but I can tell you orally. So today's journey will be on AI, training, generation, validation, and drug candidate deployment. Got it? Shall I move to the next slide? This is the preface, which I want to tell you. So this is the pipeline what we have adapted. Got it? Yeah, it is kind of a messy kind of pipeline. I'll take you each and every step, what is the technical nuances and rationale behind each and every step. Right. First step is on data curation and pre-processing. So as the previous speaker touched about something on Kimball, zinc, all this aspect. Next step is on new model development, the AI architecture, and third is going to be the new molecular generation, and fourth is going to be the structure-based filter, and fifth is going to be the synthesis and in vitro validation of our one example I have taken. We are working on kinases. Okay, that's a very promising target in drug discovery. So we focus on kinase. One of the kinases is holo-like one kinase, that is PLK1. Got it? So I'm going to take you through this journey today. Right. So for the naive audience, I know you are relatively naive, beginning audience. So I have added some of the analogies to understand the basic concepts. Right. How do you teach an AI to understand chemistry is a fundamental question. Everybody AI chemistry is a fundamental question, right? How we taught AI the chemistry. The same way you teach a child to speak. நீங்க குழந்தையா இருக்கீங்க அம்மா என்ன ஃபர்ஸ்ட் கொஞ்சம் லெட்டர் சொல்லி கொடுப்பாங்க அது that baby will try to recreate திருப்பி சொல்லணும், right? Same way you teach a child to speak through examples, lots and lots of examples. Likewise, our AI learning from massive chemical database of 16 million compounds from the zinc. So we have trained our model adequately by giving a knowledge of 16 million compounds. So why the scale matters? I can train on 100 molecules, right? Or 100 words. Why the scale matter? Why 16 million compounds is there? I have given another one analogy. What does scale matter so much? Think about how human learn language. A child who hear only 100 words will have limited vocabulary. Am I right? 100 words தெரிஞ்சா அதுக்குள்ளேயே தான் சுத்திட்டு இருக்கும். This is called as in psychiatry, this is called as concept driven perception. எவ்வளவு தெரியுதோ அவ்வளவுக்கு தான் நம்ம மூளை வேலை செய்யும், right? But expose them to millions of words, sentence and conversation, they will deploy fluency. That's the crux why we pre-trained our model on 16 million compounds. புரிஞ்சிருச்சா? Are you able to understand? Try to understand and try to collect the keywords, do search and come back to me if you have any doubts. Our AI need to see millions of molecular conversation to understand the deep pattern of chemistry, which atom likely to bond together, what makes molecules stable, and how structure related to a biological activity. So that's the crux. Got it. How this is a small pictorial representation of whatever I spoke. Small words, small concept driven perception. If you are reading many things, then your concept driven perception will go beyond and the AI will learn the fluency. Likewise for the chemistry as well. Got it? Shall I move on to the next slide? Right. Now comes, that's a quantity. Big quantity I have trained the model. I need quality. I want my AI to generate specific inhibitors for the kinase PLK1. So for that, quality over quantity, that is the PLK1 focus, right? So, but raw data doesn't enough because we need to focus on high quality examples. I want my model to train to develop the drugs for the PLK1 inhibitor. From massive database, we have identified already 569 PLK1 inhibitors which have shown inhibitory activity within nanomolar. In drug discovery, we should always focus on the drug or the chemical which acts at the nanomolar volume and nanomolar concentration. Micromolar level செஞ்சுச்சுன்னா நம்ம ஜூஸா குடிக்க முடியும். We need to take it as a tablet, no? We want the efficacy to be in nanomolar, right? So we have identified 569 PLK1 inhibitors after careful deduplication. திருப்பி entry இருக்கக்கூடாது. So we have to do all these things. And PLK1, this is a different story how we ended up with this target. That's a different separate session where we have implemented AI also to identify the target. If time permits, if the management calls me again, I'll come and deliver you and talk on how to identify the target by pulling huge amount of data from TCGA data set. TCGA, make a note. Whatever I say, TCGA, go and search what is TCGA. So you have to put the patient data, apply your knowledge, curate it, and then try to find out the target. It's not mere looking at the literature. You should look at the real data and pull out the target perfectly. Like that, we have identified a target called as PLK1, and almost all the pharma companies are doing this. Okay, so there is one candidate in the phase 1 trial. So there is no established drug for PLK1. So we are also relatively competing with our small infrastructure. Existing inhibitors proven validation, clear structural activity relationship, high therapeutic potential. This focused data sets become our fine-tuned set. I'll come to you what is meant by pre-training and fine-tuning. Make a note. What is pre-training and fine-tuning? These are the important words if you want to really work on AI. So pre-training and fine-tuning. Pre-training, we did it on zinc 16 million compounds. Fine-tuning, we are doing it on 569 PLK1 inhibitors. Like giving our AI specialized training to become an expert on PLK1 designer, not just a general chemist. The first pre-training is a general chemist, and the expert of PLK1 inhibitor design is a fine-tuning. For that, we have used this data set. Right. Are you able to follow? Now I speak about data set. How to make a crystal clear, a good data set is a question now. For that, what we can use? We know to rely on all online tools. We have something called as RDKit. RDKIT. Make a note, RDKit. Got it. That's almost all the companies will rely on the RDKits. It's a open source chem informatics software, a module where we can integrate along with the Python, and we can do all these parameters. So by using the RDKit and Python environment, what we did, we removed salts and counter ions to standardize the molecular structure. Sodium order, chloride order, right? We want to remove all these things first and foremost. Next is eliminate duplicate entries. I don't want multiple entries. I want to remove. So duplicate entries has to be removed so that the model won't get biased. Got it. And third step is correct syntactic errors. So as I said, almost all the chemicals are written in the smile forms, canonical smiles. So we need to make sure whether the smiles are correct or not, because in databases you will find errors. So you can correct all those errors by using the RDKit Python environment. I'll show you, if time permits, I'll run a program and I'll show you how it operates. And then the most important part, most of the students and even the faculty won't do. We know L and D form are, sometimes L form is active, sometimes D form is active. We need to preserve the stereochemistry as well, no? But we won't do that. We just simply do the molecular docking like a novice in the individual. So we need to put our mind so that we have to convert the canonical smiles to isomeric smiles. That can also be done using RDKit. Go and learn about RDKit, then you can be able to understand. So that this will preserve the stereochemistry information. Which form is more active can be easily well defined. Okay, so it maintains the stereochemistry chemical information critical for biological activity. So now our data set is crystal clear. There is no counter ions. There is no duplicates. I have converted canonical smiles into isomeric smiles. There is no syntactic error. Now my model can be trained on a well-defined, perfect integral data. Got it? So how we standardize, how we collected, which databases we look into and collected all those data. So as I said, Campbell is one of the important things. And another thing, we have automated all this process. If I give a code, it will go surf in the net, surf in their database and pull down within a fraction of 5 to 10 minutes, I'll get all this list. If you do a manual curation, it will last months and all these aspects. So for example, I'm giving you, we have pulled down Chemical 825 compounds with less than 100,000 nanomolar activity. Likewise, PubChem, you make the databases names. These are very important for, and then BindDB is also very important database where you will get the patented molecules data. Whereas in Chemical, we have another one site called as Sure Chemical where only you can retrieve the patented data. So whereas in BindDB, you can also get the patented data. Patent பண்ணிருக்காங்க molecules. We need to have that molecules also for our training, no? Otherwise, our model will be biased. It will try to produce a patented one, right? Next is protein data bank, where they will also crystallize the compounds with the protein. That also we need to take. So comprehensively, we looked into all the database and curated 2,617 known PLK1 inhibitors. Now comes the next question. Repetition கண்டிப்பா இருக்கும்ல because all databases will capture, right? So we did post pre-processing and we have defined our data set into 569 high quality inhibitors. Okay, and there is a 78% of reduction ensure only valid and non-redundant compounds are retained. So 569 compounds for fine tuning I have. So final summary is I have a source data of 6 million compounds. I have the target of 569 compounds ready for machine learning and model training and validation. Got the point? This is how all the industry will operate. Got it? We need to know how the real world works rather than reading in the textbooks. Got it? Right. So I was speaking about what is pre-training, fine-tuning. You should ask question, what is meant by pre-training? Pre-training is general chemistry. Fine-tuning is specialized chemistry. What is the major difference between the pre-training and fine-tuning? So start point, I'll explain you what is weight. Make a note what is random weights and all. Just try to explore what is all those things. So the pre-training will be performed in massive data set like zinc, 16 million compounds, where fine-tuning will be done on the focus data set like PLK1. Got it? Next, cost is very expensive. 16 million compounds. I need to have GPU. I need to have NPU. Anybody know what is NPU? We know only CPU. Next is GPU. Now it is NPU. If you want to get a laptop, you have to get NPU, Neural Processing Unit, or you should go and check the spec. If it is having NPU, then you can get that laptop in the same cost what you are getting for CPU, and you can run locally all your programs in your laptop. My laptop have GPU, my laptop have NPU, and my laptop have CPU as well. So we can integrate. So we have to put your mind and get the laptop appropriately. Right? It's very expensive and immediately inexpensive. Timing for pre-training, it takes months. Okay, we have pre-trained the model for 3 months. Got it. And this fine-tuning, it will end up in hours if you use GPU system. And then purpose, learn general patterns for strings for specific tasks. And this is a broad and foundational. It's narrow and top specific. So whatever you do, you need pre-training or the foundation model where we do. So the typical workflow is pre-training, fine-tuning, and deployment. Got it? Pre-training, fine-tuning, and deployment. Make a note. It starts with pre-training, fine-tuning, and deployment. Go and search about what is pre-training, what is fine-tuning, and what is deployment. That's the generative AI. Got the concept? So make all the vocabularies if you are new and try to understand all these aspects well and good. All right. So now comes the big task. Is it a big task to process all the data, pre-processing? As I said, no, 16 million compounds, 596 million compounds. Is it a big process? No, it's not at all a big process. We have devised a Python code. If you give the input of 16 million data, it will process in 10 minutes and it will give me the report. Okay. If possible, I'll give a live demo at the end. Okay. In between. Okay. If possible. Right. So we have pre-training and fine-tuning data sets. Now I want to make my algorithm to learn the chemistry. For that, we have to make a dictionary first. This is called as the chemical dictionary. Okay, it has 1 character, 2 character, 3 character, bracketed, branched, and then how the vocabularies has to be joined. So there are 313 characters for building a chemical library. So we have made this. It's a Python code. It's already coded by us. So we have a Python code. This is a medical dictionary. So it has 313 characters. By doing all this combination, my machine learning algorithm can do very well. Let's see. This is like creating a chemical dictionary that defines every possible word. CH3, CH2OH. H is already defined, so CCO it is mentioning. It won't recognize. It is already defined. For example, why this matters? Just like you need to know H2O means water, the computer need to know CCO means CH3, CH2OH, that means alcohol. Right. For that, we have to make our computer to learn. For that, dictionary is very, very important. The dictionary is already made and it is coded. Got it? So this is the second coding. For that, we have named the smiles vocabulary.py. So this is also coded. Dictionary போட்டாச்சு. இப்போ அந்த பேபியை படிக்க வைக்கணும் dictionary. Got the point? For that, we need something called as translator. This means a smart translation that can break down those chemical formulas into an understandable pieces and convert these pieces into numerical number that the computer can work with. This is called as translation back from numbers to the chemical formula. Because computer can't learn chemicals. See, it only work on binary values. 1, 0, அப்படிதான் can only work on the binary values. So we have to code. For example, this is a code. So by using the dictionary, 1 character, and it will encode as 12. C means 12 and O means 14. Like that, 113 characters are coded properly. 113 vocabularies coded properly. So, encoding for the input made you will inside the computer and it will decode. Encode no That's how we make our algorithm to learn the chemistry properly. Got the point? Are you able to understand? Basics தெரிஞ்சுக்கோங்க. Right? That's how. So for that we will use this tokenizer Python algorithm to do it. Well, yes. So we have 16 million compounds. We need to pack it accordingly to make the model to learn properly. இல்லைன்னா for example, பருத்தி மூட்டை 16,000 மில்லியன் பருத்தி மூட்டையும் அப்படியே ஏற்ற முடியுமா? முடியாதுல்ல. We have to make it in a specific box, right? With proper coding, codified up like that. For that, what we do? I'll give an analogy for you to make you understand the fundamentals. See, think it's like an Amazon packing process. So take a raw chemical data from a text file. You can think about a gunny bag with a lot of cottons. Use the tokenizer to convert each molecules. Pack these things into an efficient shipment box. That is called as tense flow record, TF record. If you really want to do generative AI, or deep learning, you should know 2 things for packing. One is tense flow and another is called as PyTorch. PyTorch. Make a note. TENSO, tensor flow. TENSOR, tensor FLOW, tensor flow and PyTorch. These are very simple, sir. No need to worry about all this as well. It's very simple. We need to pack in an organized way so that the machine can learn it properly. So we have 2 things. One is tensor flow. We have this tensor flow. Next one is the PyTorch. Got it. So labeling each box with molecular length, encoding tokens and molecular ID so that when it decodes, we can easily learn. Got it. For this also the code is made. Here is the code. Right. So why we need to use the tensor flow? It can speed the loading performance like just relate with the practical day-to-day analogy. Easy load பண்ணிடலாம்ல கரெக்டா பேக் பண்ணி வச்சிருந்தாங்க for loading, and it is memory efficient, and it is in the standardized format. Everything is standardized so that we can easily do the algorithm properly. So without TensorFlow, it takes 30 seconds per epoch. I will tell you what is epoch in coming slide. This is also a new term. Make a note, epoch. Without this, you can't do anything on machine learning or whatever it may. Right. So with TensorFlow, 3 seconds per epoch, and it requires the memory of 2 GB only, and formatting is done once. So no need to worry. So overall, what we have seen as of now, இப்போ வரைக்கும் நம்ம என்ன பார்த்திருக்கோம்னா ஒரு இன்புட் ஒரு கெமிக்கல் இருக்கு, ஃபார் எக்ஸாம்பிள் எத்தனால், அதுக்கு ஒரு ஐடி கொடுத்திருக்காங்க. So we use the SMILE vocabulary, that is a Python code which provide the vocabulary. Based upon that, it will tokenize into C1, 1 and 1, and it will encode as 12, 12, 14. Okay, then we have to pack these chemicals in the TensorFlow. So it packs like this. Lens means there are 3 characters in it. CCO. Then it is also coding, encoding as 12, 12, 14, and it is also encoding the molecular ID. Got it? So that's how we pack it properly. It's packed properly, right? Now we have to load this TensorFlow and put into our algorithm. Okay, so next we are going to see about the algorithm, right? So we are speaking about neural networks, neurons. There are different algorithms. The base one is RNN, recurrent neural network. Okay, what is the problem with the recurrent neural network is it can't memorize a lot of things. There is something called as vanishing gradient. If the memory is keep on accumulating lots and lots, கொஞ்ச நேரத்துல எல்லாம் மறந்து போயிடும்ல. That's the problem. So RNN is for sequential data, SMILE is a sequential data, but it has short-term memory only. நம்ம படிக்கிறோம்ல, கிளாஸ் எடுக்கும் போது ரொம்ப இன்ட்ரெஸ்டிங்கா இருந்தா கொஞ்சம் ஞாபகம் இருக்கும், திருப்பி ரீகலெக்ட் பண்ணலாம் அப்படியே போயிடும்ல. That's RNN. Okay, and next is called the CNN, convoluted neural network. This is used for computer vision and image processing. They don't have any role in drug discovery. ஒரு எக்ஸ்ரே இருக்கு, ஒரு எம்ஆர்ஐ இருக்கு, அதை போய் படம் பிடிச்சி என்ன டிஃபெக்ட் இருக்குன்னு கண்டுபிடிக்கணும்னா we can use it CNN. It don't have any role in drug discovery. Next is LSTM. LSTM stands for, make a note all this point. LSTM stands for long short-term memory. The problem with RNN is memory. So they have rectified with LSTM, that is long-term and short-term memory, so that it will memorize most of the things. Got the point? But the problem with this LSTM is it's very computer intense. Lot of parameters will come inside. So they have simplified this LSTM into GRU, that is gated recurrent unit. Gated recurrent unit, that is GRU. So we have used GRU for our drug discovery. The ultimatum is something called as transformer. Your ChatGPT is working on transformer model, where you can generate image, where you can generate whatever you want. This can be generated. That is transformer. Our lab is currently working on transformer model. Soon it will be completed. So we have generated GRU model for our use case. It's a small molecule. GRU model is more than efficient. And this is the thing. Got it? So the site description is given for your reference. You can refer to it. So neural network architecture comprises of RNN, the base one. Next is CNN for image. Then LSTM, long-term and short-term memory. And then GRU for gated recurrent unit, and transformer is an ultimatum. Most of your chatbots are working using the transformer. This is the crux which you need to understand fundamentally. Got it? Go and read about all these things. Try to acquire knowledge. Right. Next comes the model architecture. We need to know about model architecture, how this model is going to work also. So it is little bit complicated math. So I will simplify as much as I can possible. Okay. So as I said, there are 130 vocabularies. Those are called as tokens. So this will be fed and it is converted into 6-dimensional vectors. Okay, if you want, you can put a heat, maximum heat to it, so that 28,000 parameters have been encoded inside. So converted digital tokens into dense representation. What is the purpose? Embedding is converting the technical information tokens into dense representation. This 256 will be either 512 neuronal cells. That is neural network. 512 neuronal cells நாங்க எங்களோட ஸ்டடியில யூஸ் பண்ணிருக்கோம், which is an ideal one. Higher you can use up to 1042 as well. So these 200 dimensions are very 500 dimension states, that is neural network. So how many parameters it will encode? 0.6 million parameters it will encode. So then you can think about the complexity of our brain and how much information it is taking and other things. The sequences are in chemical context. It will try to remember all the things. Next, this 512 dimension again turned into 113 probabilistic token, which has 58,000 parameters inside. So what it does, it will predict the next token. That's an ultimatum. It has to learn and it has to predict what has to come next. Right? This is our model. So in this model, we have generated new molecules. Right. So for pre-training, as I said, we have 16 million compounds, which is already packed in a TensorFlow record. TensorFlow photos only correctly packed. Now I have to put all this inside this model and make the training properly. So there is something called as HippoChess. What is HippoChess? We'll see in the next slide. Right. So these are the ideal optimizer, Adam optimizer. I don't want to get much details into it. These are the standard in the machine learning process. So now comes the HippoChess. You can relate to yourself. If you read a book once from front cover to the back cover, how much understanding you have? To an extent, little understanding. If you repeat the process, how much understanding you will have? Little bit better than the first time. That is called as HippoChess. HippoChess means one complete process was all the training with the real world learning analysis. Imagine you are studying for a chemistry exam with a textbooks containing 1 million different molecules. At first you will read through all 1 million points. You will learn a little bit from each one. By the end, you will see every molecule exactly once. One body will you do multiple reading process, multiple. Course one, first time reading, you will understand basic patterns. Second time reading, you will notice more complex relationship. If you read it third time, you will start to recognize advanced pattern. At the initial time reading, you become an expert to predict molecular structure. Correct? அப்போ நம்ம மாடலை ஃபர்ஸ்ட் டைம் ரீட் பண்ண வைக்கணும், செகண்ட் டைம் ரீட் பண்ண வைக்கணும், தேர்ட் டைம் ரீட் பண்ண வைக்கணும், அப்படியே போயிட்டே இருக்கணும். That process is called as HippoChess. Make sure what is HippoChess. Make a note of it. Right. So when I have to stop? When I have to stop is the next question which has to come into our mind. So for that, we need training loss, and another is called as validation loss. I'll explain you what is training loss. I'm training the model with 16 million compounds repeatedly for many times. Okay, training loss is what? How will the model work? Actively learning from. Here it is again compound. Perform on a practice. Have been studying. படிச்சிட்டோம், அதே ப்ராப்ளம் எக்ஸாம்க்கு வந்தா நல்லா பெர்ஃபார்ம் பண்ணும். ரைட். தட் இஸ் கால்ட் அஸ் எக்ஸ்பெக்டட். நீங்க நல்லா படிக்க உங்களோட பிராக்டிகல் பெர்ஃபார்மன்ஸ் எப்படி இருக்கும்? நல்லா இருக்கும். அப்போ லாஸ் குறையும் தானே. யூ கேன் see here training loss. First time my training loss is 4. Next time when I train on to loss is getting 20 people just 1 and then 30 people is 0.5. Yes, which gradually. Now comes the next question. All of a sudden, pharmacognosy teacher came and conducted surprise test. What will happen? If you have understood the previous concept only, you can perform best in the surprise test. No, that is called as validation loss. Got the point? So we will get some new chunks, new data to look at how the performance is going on. This is called validation loss. It's showing how it is performing. So it is also reducing 4.2, 2.1, 1.1, 0.6. So there are two terms in generative AI. One is training loss and validation laws. Now comes the question, when I have to stop, sir? Otherwise, the model will start memorizing it. It won't perform well. It will start memorizing. மக்கடிக்கிறான்னு சொல்லுவோம்ல மக்கடிக்கிறான்னு சொல்லுவோம்ல அது பண்ணிடும். அப்ப எப்போ ஸ்டார்ட் பண்ணும்? See, you can see training loss is coming down. But validation loss after 20 codes is going up. 1.4 to 0.02. Then what is the point? The model is we started memorizing it. Right? இந்த இடத்துல மாடல் என்ன பண்ணுது? Learn, predict பண்றதை விட்டுட்டு மெமரைஸ் பண்ண ஆரம்பிக்குது. So we have to stop here and we have to snapshot that weight. As I said, weight, no, that weight. Simple analogy I tell you. Right. The best weights are like taking a snapshot of your students' brain at the moment they perform their absolute best on the sunrise test. அந்த weight இருக்கு இல்லையா அதை அப்படியே கேப்சர் பண்ணி the computer will capture. That is the base for fine tuning. Got it? Are you able to follow? புரியுதா ஓரளவு? It's very simple. I'm telling you, this is very simple, nothing complicated. Only we have to relate everything with us. நம்மளோட லைஃப்ல ரிலேட். Got it? Any doubts? Shall I move on to the next slide? So, general chemistry is done. For our model, we went up to 20 epoches and snapshot the best weight. Now I want to train, that's a general chemistry. I want to make it specialized one. Now in that way, I have to train, fine tune my model. So here also, as I have now, that I have fine tuning, and you can see where after 16 inputs, the validation loss is going up. So my model is started memorizing it. I have to stop at 16 square and capture the best weight. Now I will ask the best way to generate the molecules. That's simple. Got the point? This is the logical flow of almost all generative AI algorithm. Got it? Shall I move on to the next slide? So now comes we need to generate the molecules. Weight எல்லாம் capture பண்ணியாச்சுப்பா. இதான் அந்த 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 பையனோட பெஸ்ட் பர்ஃபார்மன்ஸோட வெயிட் எடுத்துட்டோம். அதுல ஒரு புதுசா ஒரு நம்மளோட என்ன டார்கெட் வேணுங்கிறத ட்ரெயின் பண்ணிட்டோம். That weight also we have captured. Now I want to generate the molecules. How we can generate the molecules? There are 4 strategies. There are many strategies. These are the best practice strategies. One is called as greedy. As human, we are always greedy, no? Yeah. Next comes top K. I'll explain what is top K. Then comes top P, and next is the hybrid. We'll explain you in your language what is greedy. Always pick the most likely option. If you go and do the Google search, what it will do? First page la irukadha mattum dhaan edupinga. That what the model will also do. It will go and most probable tokens it will take. ஏற்கனவே நம்ம ஃபைன் டியூன் பண்ணிருக்கோம் இல்லையா, அதுல இருந்து ப்ராபபிள் டோக்கன்ஸ் அங்கங்கேயும் எடுக்கு. So it's predictable molecules. So it will keep on repeating the same thing. So we won't get diverse chemical molecules. We need diverse chemical molecules. Why? At the end, we need to commercialize. We need to go for patent. Right? Molecules, what is the point? Next is top K. Here we have kept top K means mean. Here we have kept K as 50. Means pick random top 50 options. So choose top 50 Google search. And the 599 la 569 molecules la irukku top 50 features மட்டும் எடுத்து உங்களோட மாடல் பில்ட் பண்ணு molecules. Next is top P. It will try to add up to 90% confidence the molecules come. That is called as top P. If you combine these two, that is called as hybrid. These are the sampling strategies which we generally adapt for molecular generation. Like that, we have generated. I will show you a live demo how we generate the molecules now. Just by running. In few seconds, it will generate a good amount of molecules. So, top P, we have generated 10,000 molecules. Top K, we have generated 10,000 molecules. And hybrid, we have generated 10,000 molecules. Next comes the question. whether the all molecules are same or different. So for that, we need to know what is the amount of scaffold diversity. Scaffold, as Sarah has explained already, scaffold is the basic architecture. Or skeleton இருக்கு இல்லையா? That is called as scaffold. Students, please listen. Don't make noise. Please listen. Please listen. Please listen. I'll remind you again, this is a technology wave. If you are left behind, you can't catch this wave. Got it? It's the right time to capture whatever you want. Right. Right. So we want to look at how many unique scaffolds are present when compared to each other. We have found out top we have 6,851 unique scaffolds in 10,000. Likewise, K has 8,022 and hybrid has 6,855. So our model is predicting more amount of unique scaffold, unique molecules. So 70% of the compounds have zero violation for Lipinski rule of 5. As I was speaking about toxicity, no, the Lipinski rule of 5 will eliminate almost all toxic compounds. So 70% is non-toxic. And in drug discovery, we can accept one violation. You all know, right? So our model can give molecules 90%, which can be used for drug discovery. And there are 9.9% validated molecules have more than one rule violation. Alright. So here also the model can repeat the same molecule. So we have to perform deduplication and we have ended up 27,153 molecules as our newly generated molecules. Got it? Right. Shall we see a demo? இதை எப்படி பண்றது? இதை க்ளோஸ் பண்ண போயிடுமா? Right. மேடம் இது ரன் இதே ரன்
ஸ்கிரீன்ல தான் சார் இருக்கு.
ஷேர் ஸ்கிரீன்ல அந்த இஷ்யூ சார் இந்த ஸ்கிரீனை ஷேர் பண்ணு. சேஞ்ச் இல்லையா மாற வேண்டும். இல்ல இது அவங்களுக்கு தெரியணும். இல்ல ஒரு நிமிஷம் ஸ்கிரீன்
ஜெனிஃபர் அக்கா, உங்களுக்கு தெரியுதா போன்ல பைத்தான் ஸ்கிரீன் தெரியுதா?
இது இல்ல மேடம், வேற ஏதாவது
வேற ஏதாவது
வேற ஏதாவது
கொஞ்சம் ஏதோ சொல்லுவாங்க. தேங்க்யூ சார்.
இதுல ரன் பண்ண முடியாதுங்க. யூ காண்ட் ஆபரேட். ஸ்கிரீன்ல தெரியுதா மேடம்? இட்ஸ் ரன்னிங். இஸ் இட் ரன்னிங்?
லைவ்ல தெரியுது சார். இங்க தெரியும்.
ஸ்கிரீன்ல தெரியும். இட்ஸ் ரன்னிங்.
இங்க தெரியுது சார். அம்மா
why it's not showing? We need to slow them, right?
ஸ்கிரீன்ல இங்க அவைலபிளா உங்களுக்கு வருது. உங்களுக்கு வரல சார்.
Share the entire screen, right?
சிஸ்டம் கரெக்டா இருக்கு. சிஸ்டம் ஸ்கிரீன் இங்க
Yeah. See, wait. See, my motivator is right.
Entire screen.
Yeah, got it. Now you can see, I just run a script which is inbuilt and it started generating the molecule for dog gates. When we end those molecules within fraction, it started generating hundreds of molecules all of this sudden. Got it? Yes. Got it? That's the simple magic bullet. For code on பண்ணிட்டேன்னா it will run. I'll show you again if possible. I'll stop it in between. I stop. Now I'll run the code. That's all. It will gather all the dependencies and it will start generating the molecules in a fraction of a second. That's all. Right. That's all. So we have, so this operates based on 5 dependencies. It gathers and it starts running it starts generating the molecules. Yeah. So molecules are generated, but it uses GPU. In CPU, it will take more, for generating 3000 molecules, it takes nearly 2 to 3 months. But in GPU, we can, within 15 minutes, I'll generate 30,000 molecules. That's all. Yeah. So we'll go to the presentation. Shall we go to the presentation also? So for that we need to use some codes. So I'll show you the production code. This is a code which is custom built code. You can't find it in internet. No. We need to have domain knowledge. We have made this script. So this is a script. So this is a script which we have devised using Python. So if you run the script, it will take all the dependencies, vocabulary, tokenizer, TensorFlow, put it in GRU RNN model, and then it will try to generate the molecules. That's all. Done. Go ahead. So now you have to tell me, is this easy or you want to do screening virtual library or go and collect all the molecules, do virtual screening? Is it easy? This is easy, right? Yeah. Now we'll go to the site. So the first phase is over. We have generated 27,953 new molecules with just got it. Now comes the major twist. Other than common problem. I know first I use for two trains, then I use PLK1 for fine tune. So I have randomly picked the molecules, 3000 molecules from, you see, 3000 molecules from our generated data set. And fine tune, I have included all the molecules. Unsupervised that is called class. Initially initially devised PCA. Next advanced version is T-SME. And it's human particle domains. It will convert the molecules into bits. ஒரு molecule என்ன பண்ணோம் அப்படின்னா ஒரு 4096 then we will convert all big dimension data to domains.
each other without doing you one. Who are these other people? Are really part of the grade. So with that done, absolutely and so our we stop validate whether our molecules, our model has learned the properly. Remember, single line dating. Number of different molecules are in blue. That's what clearly and not in the sink area. So transfer learning has happened. Well, got it? Right? Shall I move on to the next slide? Now come the most important part of drug discovery. This is called as advanced informatics. This is not the all molecular talking one in speed. It's nowhere in the because we are not used to generating not used to pretty much of neural cortex side. This is called as advanced in informatics. So everyone is completed. Now we are moving to the advanced in informatics. So this is also very important. We'll see. So I have 27,000 results. Whether I can prepare all these ligands for now, it has to make sense which ligands I have to choose. Whether I can do it randomly or we should not do it. Randomly. Because the compound may exhibit in autonomous, isomers, and everything. So, link preparation module, ligand preparation module, 96 modules. Now we need to apply the filters, and that has to make sense. Without filter apply பண்ணணும்னா that has to make sense. Otherwise, we should not apply. You know, for the filters. So we want unstable forms. We don't want unstable forms in our body. So I want to remove the unstable. And smaller size. I don't want smaller size as well as I don't want bigger size. Smaller size, bigger size will eliminate cost as smaller size. So I want bind the target. And formation. Balance. Partition to every. Yes. It only retain the compounds which are regular. Because it is age generated. It should be feasible for synthesis. As I was speaking about reduce, I don't want to complicate myself. I want to have the compound which can be used for so after that, when all these filters, we have simplified our classified to 23 compounds. But I'll give you a brief rationale of each and every filters and their optimal values. Talking about filter, we have to keep an optimal value of 0.8%. So what we have, molecules is one stable one. If you apply that filter, then stable molecules only we can. Remaining will be sent out. Ionization penalty. Your molecules has to behave both in stomach as well as in the blood in the same way. Right? It should not degrade. As the molecule even with the body. The stomach acid. The ionization penalty should be less than or equal to 2.0. Beyond, if a compound is having this, remove it. I don't want to enter into any false positive result. I want more meals. Let's not 1 to 500. You can little bit extrapolate to 550. Okay, one violation is always acceptable to this. And wrong. It's all enough to learn. A certain brain needs this. So we have to make this out of research. So celebrity. Absorb celebrity entry. So far we have this to that. It's a total score. Whether drug like this score we use. So it's not like a real drug. The molecule number generate money in the molecule. May drug
And then you can see what by the relativity for the specific accessibility filters. For that, we have put the value. If the value is more, 10 இருந்ததுன்னா the synthesize பண்ண முடியாது. The value is less, it can be easily synthesized. So how we can compute all these things? We can use simple RDKit and some GitHub libraries are there where we can put the dependencies and we can calculate easily. So it's not a big task. So as of now, the previous filter answer is this a value drug-like molecule? ஆமாப்பா நான் filter எல்லாம் பண்ணிட்டேன். இது ஒரு drug-like molecule. Now comes the next complex question is these new filter answer with this drug actually work when it reaches its target or not? Drug-like அது டார்கெட்ல போய் உண்மையிலேயே போய் பைண்ட் ஆகுமா இல்லையான்னு தெரியணும் இல்லையா? For that what we need to do? For that we need to do something called as pharmacophore. It's a structure-based pharmacophore, ligand-based pharmacophore. Many things are there. So this also we have accelerated. So it will go online. It will pull down all the PDB structures. And then it will give all the inputs like interaction, CSV will give, bucket heat map it will give, feature CSV, excluded volumes, ranking of the PDBs, analysis summary report it will give. I will also show that so that you can able to, or else if you want to spend on pulling down the PDB structure, which PDB structure I have to pull down, what I have to analyze, which is the hotspot, it's a headache. So we have automated that also. Just give a click, it will try go and it will provide you the data. Let me do that also for you. Again, it's a problem, I think. Do so. Yeah. Okay, I'll show you later on. It's having some glitches. I don't know why. Yeah. So sorry, it's having some glitches. So it will try to go and find out all the data, then pull and find heat maps. These are the two heat maps it will give. So the heat maps give an idea on which pharmacophore we have to choose. This is for aromatic as one and ionic negative. Okay, without knowing, without understanding, if you design a drug, this will end up in disaster. You will waste your time and you will suffice. Nunipul means to grow. We have to dwell deeper and try to find out the ingrained roots of what is what. So based on that, since I am designing a kinase inhibitor, I should focus on the hinge region. So if you go and look at the PDB structure, they have defined all the regions properly. Hinge region is a flexible region where the ATP will bind. Got it? So, it should have H bond and it will also have the hydrophobic core. I mean, the brains, இல்லைன்னா any hydrophobic structure, you should have H bond donor or acceptor need to be present. And the expensive it should have nitrogen, it can donate or not. So that can easily gather. Instead of 6 so if your compound is making an interaction of H bond with this amino acid and it is also hydrophobic in nature, then it's an ideal charge. Point number 1. Point number 2 is gatekeeper. Right. See, since I am deciding a compound, it should prevent the binding. So my molecule should also bind to any of the amino acid. That's gatekeeper. It's as a point. ஏதாவது ஒரு CH3 group இருக்கணும் அதுல ஒரு donor வரும். So if it binds to that and this region, then only you can design a rational drug. Next comes the solvent front and back. That is not required because I am focusing on orthosteric inhibitor, not allosteric inhibitor. Next is aromatic side. Please listen. These are very important in drug design. Right? At least make a note. So that when you are giving, so don't do anything talking blindly. Try to understand what is in the region. Make a note. What is gatekeeper is given. Make a note. Okay. What feature is required? So based upon the PDB, it has given a sound knowledge that the gatekeeper should be hydrophobic and H bond. Based upon the hinge, it should be H bond and hydrophobic. And aromatic side, this is called as pi-wise side. One more molecules is stable inside the packet. It should form pi-wise second in this amino acid, that is 131 in this case. So if you have this knowledge, you can very well make a pharmacophore hypothesis. And the hypothesis report that. Right? Now I sent all my 25,000 molecules inside this hypothesis and try to find out which is the best match. Got the point? Before that, we need to validate your docking also. That is, you have to extract your ligand, read off it, and try to compute what is the root mean square deviation. Root mean square deviation should be relatively less. Okay, it should be less than 1 angstrom. Then only your docking program is doing well. Without performing all these aspects, if you do blind docking, you will end up in disaster. Sorry to say that. Right. So I have passed all my molecules, something called as pharmacophore. It also has some scores. I have to filter based on the scores. Otherwise, again, we will end up with a false positive result. I want to put a molecule which need to be synthesized. For that, we have something called a space screen score. These are done in Schrödinger. Okay, don't worry, Schrödinger will give you free license for 3 months for the students. If you request, they will give you. You can do all these things in there, not required for purchasing and all these aspects. So phase screen score, it's an overall fitness score. So the overall fitness score maximum is 2.5. If your molecule's fitness is greater than 2, then it can be categorized as excellent. And align score, this is very important. Mostly we will look at the phase score and we will leave the align score. What it means? If your binding packet is shape, active site la binding packet L மாதிரி இருக்கு. உங்க molecules L மாதிரி போய் fit ஆகும்ல. If your binding packet is also being in shape. That is called as align score. If the align score is square and phase score is the overall score. So you should also look at the align score. Next comes the vector score. This is also very important. I'll tell you why. If a protein charging the opposite spot, then only it will interact. Otherwise, it will end up in disaster. Next is volume score. This is that the drug fill the target packet efficiently or not. So drug should not leave big empty space or too little or bulky space. Full up pack. So based on this, we applied few filters. Phase score should be greater than, align score should be greater than 0.7 because maximum is 1, and vector score should be greater than or equal to 0.7, and volume score we kept it as greater than or equal to 0.7. So that we have preferred what molecules into highly preferred and moderately preferred. Got it? Once I send these molecules, it have yielded 324 highly preferred molecules and 132 moderately preferred molecules. My focus is going to be only on highly preferred molecules. Got it? Next comes the classical way. We'll speak about talking. Is it a simple talking? There's a lot of technical nuances inside. I'll take you into that also. Okay. So basic filter we have, it's like a validity. We have found it's a validity. General correlate பண்ணிக்கணும். Phase filter that the key looks like it should fit. Now does the key actually work inside the locker? That's the docking. Got it? So these many filters you have to apply with a lot of common sense. Next. As we know, docking score, we want to look at the docking score. I call it minus the docking score. My compound is going to do well. That's a false propagation. False notion. You should not have that notion. What are the other parameters you have? Right? What is the binding? Right? Yeah. So that we have to always look at the glide aim on. Without looking at the glide aim on the docking score, you will end up in disaster again. So this is a very logical and ideal filters. Docking score first, next glide aim model. So I have given some threshold how to keep all these things. Then comes the ligand efficacy. For each ligand, they will give a score called ligand efficacy. Tolerance for small molecules. It should not be big. It should not have a lot of branches. So ligand efficacy threshold is also mentioned, and then glide energy and glide G-score. These are the classical energy and G-score, which is put forward for right. Based upon this, we have subjected all the 324 molecules into docking, and you can see here docking score is minus different values, and it is 4,000 standard. And you can see that the model is 112. If you go to the gliding model, you will find it's in negative, it's in positive, or very less than. And in that, it's also very important. How many heavy atoms are present in your molecules? It has to be ideally 30 to 35. That is also important. Based upon what you can classify or good, excellent on this aspect. Got it? So we are nearing the end. I'll leave you for honest. So next comes the biggest task. Whether I can go for synthesis of all the compounds? No. I should have a common sense that novelty and IP assessment is very, very important. Which compound I should go for synthesis? This can be used. This can be found using SciFinder or SureChembl, SureChembl, SureChembl. What we have to say? We have to if the substance are right, obviously somebody will have written, don't go for the compound. If it has similar scaffolds already existing PLK1 methods, don't go. That will also be better. Right. So we have those 6 molecules are novel, but they have scaffolds similar to PLK1. So I am not choosing that. Then 9 molecules are novel in both aspects. This is my ideal choice. Both in novelty subject. Scaffold is also new. I can very well go for patent. And based upon this, based on the synthesis feasibility, how many steps it will take, for synthesis, I have 5 molecules, and we have the synthesis also. And in the 2 molecules showed in a nanomolar activity, less than 100 nanomolar. Soon we are going for patent. Right. So these are sharing things. As it will, so and here I am and here all interactions are maintained. So the molecules is well and good. We can do synthesis and we can find the way out of it. So this is the overall comprehensive pipeline what we have adapted for drug discovery. Got it? So this is my lab and my teammates. Got it? So she is a postdoc who have completed PhD in oncology, and currently she is the postdoc under me. And she's Manasa, he's Rajesh, and she's Preeti, and me, and then she's Negal, who have completed in UK Leeds, and then she's working under my project, and she's a full-time scholar, Nanushia. So we work as a team and try to implement whatever maybe. Right. So this is my team, and my lab is funded with ICMR of 1.25 crores for this kind of project. This is the facility, what we have, which I have in my lab. So we have a very well established cell culture facility, and then the molecular pharmacology labs equipped with PCR, instant blot, all this aspect. And we do provide internship, 3 months internship, 1 month internship. And also I provide personal training who are so much interested in machine learning. You can contact me in this number, or you can email me in these 2 email addresses. Got it? That's all for today. Okay. If any questions, I'm happy to take.
Thank you, sir. It was such a lively and fantastic session. We have seen a live demo of the combination of human and artificial intelligence here, and you have broadened the horizon of the minds of our delegates. I hope we will also use a hybrid approach instead of a 3D one, and after pre-training and fine-tuning, we will be ready for deployment. Thank you, sir.
Hello, good afternoon, sir. Hello, sir. Good afternoon. Ravichandran, sir.
Good afternoon, madam.
Okay, sir. Can we check our speaker, sir? Just a minute, sir. Hello.
Hello, madam. Hello. Hello, can you hear me, sir?
Yeah, yes,
Hi.
sir. Yes, sir. Just a minute, sir. Just a minute, sir.
Hello, sir.
Yeah, hearing you. ma'am.
Just a minute, sir. Hello, sir.
Hello.
Sir, can you
Hello,
hear
ma'am?
us, sir?
Yeah. It's audible now.
Okay. Just a minute, sir. We are having a sound issue here. Just a few
Okay,
minutes.
okay.
Thank you, sir.
Good afternoon, everyone.
Sir, we can start, sir. The sound is now okay.
Sound வருது. வருது, ஒண்ணும் பிரச்சனை இல்ல.
Ravi, sir.
Yeah. Audible,
Shall
ma'am.
we start, sir?
Yeah,
Okay, sir.
yeah.
We will welcome you formally, sir. Just a minute, sir.
Good afternoon, everyone. I welcome you all for our next session. It's my privilege to introduce our next guest speaker, Professor Dr. V. Ravichandran, Professor and Head, Pharmaceutical Chemistry Unit, AIMS University, Semaling, Malaysia. He has completed his B.Pharm from the Tamil Nadu Dr. MGR Medical University, Chennai, and M.Pharm, Pharmaceutical Chemistry, and has received his doctorate in Pharmaceutical Sciences from Dr. H.S. Gore Vishwavidyalaya, India, through JRF and SRF, funded by UGC and AICTE respectively. He has around 25 years of academic and research experience. He began his career as an assistant professor from Fatima College of Pharmacy and has continued working in various prestigious institutions, namely KMCH, Al-Shifa College of Pharmacy, Dr. H.S. Gore Vishwavidyalaya, and currently he is working at AIMS University, Semaling, Malaysia. He has been elected as Senate member, AIMS University, Malaysia, and is an active member in various scientific committees. He has received Dr. APJ Abdul Kalam Award for Technical Excellence 2009 and Scientific Excellence 2010. Also, he has been awarded as International Scientist Award ISAM 2020 in the year 2020 and is placed in top 1000 scientists in Malaysia in the year 2019. He has received various grants to conduct research and has supervised more than 49 UG projects and 3 PhD works. He has published more than 179 articles in various renowned national and international journals and has delivered numerous lectures in various colleges and universities across the world. Let's not delay further and start the session, sir.
Okay, thank you, ma'am. 1 minute, I will start my slide first.
கேட்கல.
Can you see my slide, ma'am? My slides are visible? Hello? Hello? Hello, can you hear me, ma'am? Hello? 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 Hello?
Yes, sir. Audible, sir.
Yeah, it's audible. Can I start?
Sir.
Hello?
Hello. Yes, sir.
Can I start, ma'am?
Hello.
Hello? Can you hear me?
Yes, sir. We are hearing, sir.
Okay, can I start, ma'am?
Just a minute, sir. Just a minute.
Okay.
Yes, sir. We can start, sir.
Okay. Good afternoon to all. Thanks for. Can you hear me, ma'am? Am I audible?
Yes, sir.
Okay,
Yes,
thank you.
sir.
ma'am.
Yes, sir.
Okay, thank you, ma'am. So first of all, I thank the madam for giving me a detailed intro about me. And I would like to thank the principal and the organizing committee and the management of Periyar College of Pharmaceutical Sciences for organizing this conference on the role of artificial intelligence in integrating traditional and modern medicine, and also invited me to deliver a talk. I hope you all enjoyed your lunch. So I know the difficulty after your lunch. That is also time at, I think India, the time at 2:30 or 3. It's very difficult to deliver a talk as well as listen the talk. I know the difficulty. But please bear with me for another 1 or 1.5 hours. So first when Dr. Sagila madam called me and to deliver, requested me to deliver a talk on this topic AI, that is bridging ancient wisdom and modern healing on this conference. I agreed and I have given the title also. But morning I have attended both the lecture by Prof. Dr. Mahadevan and Prof. Dr. Jaykant. So I think they have covered maximum points. Now I don't know what I have to talk because many of the points already they have covered about AI and our pharma field. So anyway, it's look like just like a repetition of whatever they have talked in the morning. So I hope you get some few points, new points from my talk. So with that, I will continue my talk on the AI bridging ancient wisdom and modern healing. So in my talk today, so next 1 or 1.5 hours, we are going to see, particularly my talk is concerned about what are the different ancient healing philosophies and a small introduction to AI and how the AI, what is the role of AI in ancient medicine and drug discovery and also in personalized medicine. Then later on, what are the ethical parts we have to concern when we are going to use the AI? So these are the few headlines what I'm going to discuss in my talk. So why this topic? That is the important thing. So what is the need for this topic now? Yes, everywhere you can see, everyone, each and everyone, wherever the field, not only in our pharma field, you can take engineering field, agri field, medical field, business field, whatever the field you go, everyone is talking about AI, that is artificial intelligence. So what is it, artificial intelligence, and how it is going to be useful for, particularly in our pharma field? It is in academic field as well as the research field. Particularly today, our main topic is how we are going to use this artificial intelligence to merge the traditional medicine with the modern medicine. So the topic why we have to go to AI, because there is the urgency and opportunity. First, we have to see our pharmaceutical industry. I think Prof. Dr. Jaykant has covered all these things, even though I will go through little. So the pharmaceutical industry faces unprecedented challenges like in R&D cost. Once just the pharma industry want to bring one drug into the market, they have to spend near about $2.6 billion US dollars to bring a drug into the market. And you all are aware that it will take minimum 10 to 15 years to bring a drug. Then high failure rates. Once the drug is passed through the preclinical trials, but later on it's failed in clinical trials 1, 2, 3, or even in after approval also, many of the drugs is withdrawn from the market because of the side effect. Then increasing the disease complexity. Then the most important thing is growing resistance to existing therapies. That is particularly in antibiotic resistance. What is everyone, we know that what is the importance of that antibiotic resistance. So that is also the main concern why we have to go for this topic. Because in our conventional method, conventional drug discovery method, we are having lot of conventional method, and we are having the rational drug design method. That is, we have used the computer-aided drug design. I think morning Dr. Mahadevan covered molecular talking and other things, and the ADME prediction. So there we have to do one by one, because it is whatever whether it is a conventional or rational drug design, it is a time-consuming process, and we have to spend more. So why we have to incorporate AI in this discovery technique only now at present to reduce the time, speed up the time. That is the first thing. Second thing is reduce the cost. These two things are possible now, but currently the research is going on to improve the process also. So the next, the opportunity. Traditional medicine offers a vast repository of empirical tested remedies, over 28,000 medicinal plants documented worldwide, only 50% scientifically evaluated. Remaining 85% it is not explored at all by anyone. So there is a big scope is there. When we are doing research on the traditional medicine, where we are having near about 28,000 medicinal plants. So remaining 85%, it's not explored at all. So we are having wide scope to explore all this remaining 80% medicinal plant and its phytoconstituents and its activity. So AI provide the computational power to analyze, validate, and optimize. Means in all the area we can utilize it from the beginning scratch to the end. So for each and every step we can use it. I think the first lecture, Dr. Mahadevan explained all these things. From the beginning to end, we can utilize the AI tool along with our computational approach. So ancient remedies at unprecedented scale and speed. This is the important things why we are going to use the AI. So this integration represents a paradigm shift, means there is a big transfer in how we discover, develop, and the usage of therapeutic solution. So the ancient, first we can see what is ancient healing philosophies. What are the philosophies behind this ancient wisdom approach? There are some philosophies are there. One is holistic approach, which is treating the whole person, not just symptoms. The second philosophy is balance-based paradigm, that is help us harmony between opposing forces, like what we are telling, fire and water, earth and water. These are the opposite forces. Same like that, we can do the treatment. Then preventive focus, that is maintaining wellness rather than just treating illness. So here also we are going to maintain the wellness instead of treating the disease illness. Then personalized approach based on individual constitution. Then deep integration with cultural, spiritual, and environmental context. So this system represents millennia of empirical observation, because it is not the new, it's not like our recent modern medication. Modern medication is hardly having 8 to 9 decades. But all this ancient process, wisdom process are having million of years the people are using. So they are having a lot of experimental observation as well as the practice. So there are enough data, but the problem is they're having enough data in different language. Suppose if you are taking Ayurveda, it is in Hindi. If you are taking Siddha, it is in Tamil. If you are taking traditional Chinese medicine, it is in Chinese. So it's very difficult because everything is in written or in some other format, not in the digital format. First, we have to convert all this information into digital format. Then only we can use our AI, because AI will consider their digital data. So morning, I think the speakers explained the big data, how the big data is going to be handled by the AI. So we need the data. So the digital data. So that is the main problem in the conversion of the written or any other format things or image, whatever it is, we have to convert it into digital format. That is the big problem what they are facing now. Then they constitute an invaluable repository of knowledge waiting to be explored with modern analytical tools. Because many of the things it's not validated. For example, you can take Ayurvedic medicine. There are a lot of medicine, but it is not validated properly. So the validation is important. So that is also one of the things what you have to concern. Then first one is the traditional Chinese medicine. When we are talking about traditional Chinese medicine, there are some philosophical basic things are there. One is yin yang and Q and 5 elements. This is the basic philosophy, the basic of the traditional Chinese medicine. First one is yin yang, that is balance of opposing complementary or cosmic forces. Then next one is Qi, that is life energy. Q is nothing but the energy. So the vital energy flowing through meridians. Meridians is nothing but the pathway which is connecting our organ with our body surface. That is called as meridians. So how the energy is transported through this organs to the surface. Then 5 elements. This you all aware about this: wood, fire, earth, and metal and water. Then what are the therapeutic approaches? There is a herbal formulation they are used in traditional Chinese medicine. They are using formulation. They are having near about over 13,000 medicinal substances. And they are also practicing acupuncture and moxibustion. So acupuncture, just by using needle, by breaking on the particular point, that is called as the acupoint. So they will stimulate that particular point to heal the disease. That is acupuncture. So moxibustion is nothing but instead of needle, they are going to use the material that is called as moxa, that is made up of moxa hut plant leaf. So that one they will burn over the skin or near the skin, then they will produce the heat for in the particular area, the acupuncture area. How we are using the needle to stimulate the acupoint. Same thing, instead of needle, they are using the heat to stimulate the acupoint. Then try to heal the disease, illness. So that is the two things what they are using other than the herbal formulation. One is by using needle, they are doing the acupuncture. Then by using heat, they are doing the acupuncture treatment. The next one is they have also used the therapeutic massage that is called as China. Then dietary therapy and some exercise, Qigong exercise. These are the some therapeutic approaches under a traditional Chinese medicine. So dating back over, they are about 3,500 years. That is, means traditional Chinese medicine represent one of the world's oldest continuous medical system. So next we can see our own Ayurveda, that is Indian traditional medicine, that is Ayurveda system, that is mainly based upon the dosa. Dosa means our body, they are separated into different parts like Vata, Pitta and Kapha. So Vata is air and ether elements. This is called as the complementary forces, the cosmic forces, air and ether, air and atmospheric, the atmosphere. So which are the part it is covering? Covering movement, creativity and mental activity. These are the some function which is covered by under this Vata. So prone to anxiety, dry skin and constipation when imbalanced. Same thing for Pitta, it is fire and water elements. It governs metabolism, digestion and transformation, prone to inflammation, anger and skin races. For Kapha, it is covering earth and water elements, including the structure, stability and lubrication, prone to weight gain, congestion and lethargy when it is imbalanced. So these are the different concept what it is under Ayurveda. So it is older than the traditional Chinese medicine. Traditional Chinese medicine is just 3,500 years before, but our Ayurveda system is originating over 5,000 years ago, and Ayurveda emphasizes personalized treatment. Now only we are studying that is personalized medicine, precision medicine. That is like a new concept, but in our India, they practiced the same concept 5,000 years before. Treatment based on individual dosa, that is constitution, and uses extensive pharmacopoeia, plant-based remedies, often in complex formulation known as rasayanas. So next one is traditional African medicine. So the key characteristics, the basic things are deeply integrated spiritual and physical healing, because they are having more faith on these things, spiritual and ritual. The Africans are having more faith on spiritual and ritual, so they are using that concept for the treatment. Then community-based approaches to wellness, rich botanical knowledge, over 5,000 medicinal plants they are having, then ritualistic elements in healing practices, then oral tradition knowledge transmission. So these are the some basic characteristics of traditional African medicine. So one of the best examples is the African continent's diverse ecosystem have yielded numerous medicinal plants that formed the basis for important modern drugs. One of the example is the drugs, the anti-cancer drugs, vincristine and vinblastine, that is identified from the plant Catharanthus roseus from the African countries. Then the traditional healers known by various names across the different region of the Africa, that is they are called as Sangomas, Nyangas and herbalists, often serve as both spiritual guides and medicinal practitioners, focusing on restoring harmony between the individual, community and spiritual world. So next one is the global landscape for traditional medicine. So the other medicine, whatever we have seen about the Ayurveda, traditional Chinese medicine. Apart from that, there are some other concepts also there. That one of that one is Unani medicine, that is mainly used in Greek Arabian system, which have 4 humors based on 4 humors, that is blood, phlegm, yellow bile, and black bile. So prominent in Middle East and South Asia, they are using this technique. And Siddha medicine, so it is one of the oldest system in the world. That is ancient Tamil system emphasizing mineral-based medicine practiced primarily in South India, particularly in Tamil Nadu, because all the system is written in Tamil language. So we have to first digitalize the things by using, because when we want to do by ourselves by using human, that's where it will take a lot of time. If you are using computational system also, it will take a lot of time. Instead of that, we can take the help from AI, then it will be very fast, and within short period of time we can do. Already they have started the work. Then Kampo medicine, that is Japanese adaptation of Chinese medicine. Then indigenous system, that is Native American, Aboriginal, Inuit, and Mycenaean tradition, which is closely tied to local ecosystem and spiritual beliefs. 1 minute. So the richness of traditional pharmacopoeia. So magnitude of resources, because at present we are having there about 80,000 plus plant species with documented medicinal use. Because already I told there are a number of plant species, and that is a very huge biodiversity, particularly in India. And for example, where I'm staying, Malaysia also, it is well-known country for the biodiversity. So we are having near about 80,000 plus plant species with documented medicinal uses. Then 350,000 known traditional formulation globally. And we have used mineral, animals, products, and processing techniques. So all these things are there already. So how we are going to utilize these resources for the modern medicine? That is the main aim of my talk. So the traditional pharmacopoeia has provided the foundation for numerous modern drugs. For example, you can take Atamsin, that is the drug which is used for malaria from the traditional Chinese medicine. And from the Ayurveda, they found the Reserpine, which is used for treat the hypertension. Then the digitalis, which is used in heart failure from European herbalism. So near about whatever we are having already, the FDA approved drug, in that 25 to 30% of the drugs, the original it is derived from the traditional knowledge. So the limitation and opportunities of this ancient wisdom. So whatever we have seen, there's all the ancient philosophical approaches. So what is the problem in that? Then what is the opportunity? So here, the main problem, as I already said, lack of standardization and quality control. So we can take any medication in the traditional system, whether it is traditional Chinese medicine or Siddha or Ayurveda, there is no proper standardization. Means there is no specific information about what is the content of that formulation, how much it is there, what is the dose, what is the quality. Nothing was there, nothing was optimized. That is the real thing, nothing was optimized. Now only they have started optimizing one by one by Indian Pharmacopoeia Commission and other countries' pharmacopoeia. They are trying to standardize and quality control the things. So that is the main drawback, lack of standardization and quality control. Then insufficient documentation of mechanism. Yes, when we are taking the formulation, for example, Ayurvedic formulation, there are a lot of plant extracts will be combined together. So there will be a different mechanism. So there is no documentation for that mechanism. Then variable efficacy and doses of consistency. So that is also variable efficacy, because it is a mix of multiple extract of multiple plants. So there is different efficacy will be there, and doses consistency will not be there. Then potential toxicity and herb-drug interaction, that is also has to be documented. Then limited empirical validation by modern standards. So there is no validation, experimental. Empirical validation means experimental validation by modern standards. What we are having for our modern medicine, we are having the standard procedure. Suppose if you are taking paracetamol drug, the drug should be this much only, and what are the additives you have to add, where it is going, what are the trucks will go for truck interaction, or what are the other side effects. Everything is documented. But for the traditional approach, we are lacking in that area. So the opportunities, vast untapped repository for bioactive compounds. There is a lot of repository for bioactive compounds should be explored. It's not explored until now. So we have to explore the repository of the bioactive compounds. Then multi-target, because already we know that many of the traditional systems are based upon the plant source. So the plant source, already we know there are a lot of phytochemical constituents. So it is not going for the single target. It's not going to attack only single target. So we can expect the multiple target, the polypharmacy, we can tell polypharmacy. So it is going to interact with multiple target. So that should be optimized. So there is a big opportunities there. Then synergetic therapeutic approaches. That is also important, how one plant extract will synergize, means support the effect of the other track. Then holistic framework for personalized medicine, sustainable accessible healthcare solution, novel paradigm for disease classification and treatment. So these are the opportunities in traditional ancient wisdom. So these are the area where we want to explore. So by using AI. So the solution, what is the solution? So the solution is only we have to convert all this data to digital, then we can use AI. So now we can come to AI. What is artificial intelligence? Because everywhere we are hearing artificial intelligence, artificial intelligence. So it is nothing but a technology in computer science. It is one of the technology in computer science. So in this technology, the system or computer, or you can tell any machine, which is able to mimic the human intelligence. That is called artificial intelligence. Artificial intelligence represents the development of computer system that can perform tasks actually which require the human intelligence. For example, reading, listening, decision making, and problem solving. These things where actually we need the human intelligence. So the same way the artificial intelligence will work. So that is the concept, the main concept of artificial intelligence. So the main thing is learning from experience. That is improving with the data, recognizing pattern and making prediction, then solving complex problem through reasoning. So understanding and generating natural language. So interpreting visual information. So whenever we are taking the image, for example, we are going for MRI scanning. So the image is there. So the doctor has to sit and think what is there. So he has to remember a lot of things. Instead of that, we can use AI. The same thing for when you want to extract the information. Suppose I am doing a research, I have collected the literature for my research. I'm having thousands of articles. It's not possible for me to go through all the articles. So instead of that, we can use AI, particularly the natural language processing system, natural language processing in AI. So it will go through all the things. Then just like I think you all are aware about the ChatGPT, one of the generative AI. So just you have to give the proper prompt. So it will extract, it will go through all the things and it will extract information. And how we are giving prompt, suppose if you want in 100 words or 200 words or 300 words, it will summarize the things and it will give in that much particular words within second or minutes, few minutes. But just imagine if you want to go through all the 100 or 1000 articles. So that is the advantage of AI. The same thing the AI is going to do in our pharma research also, because we are having, there are a lot of databases are there. Just now, Prof. Dr. Jaikant mentioned about Chembase, PubMed, PubChem. There is a lot of databases are there. Each and a Zinc database, there is 16 million compounds are there. So that many compounds, it's not possible for us to remember each and every data, because when you are taking any compound, you have to remember the structure, you have to remember what is the different physical chemical properties like solubility, what is the melting point, boiling point, what are the functional group. There are a lot of data, sir. That big data, we are having very huge data. It's not possible to do the characterization or the evaluation of that particular structure by humans. So it will take a lot of time. So that time we need the AI and the computational, other computational technology to make the process simple, easy, and very fast, means speed the process. So that is the thing what we are going to do here. Yes, the same thing. Just now I told the databases, same thing. There is a databases for the natural product, and whatever the system we have seen like Unani, Siddha, Ayurveda, all the TCM, all it is having the databases. So how we are going to extract the information? That only we are going to see. So the key subfield of artificial intelligence. So artificial intelligence is a broad term. It is an umbrella term. So under that there are few fields are the subfields, subtypes are there. I think this is also already covered by Prof. Dr. Jaykant. So the main thing is artificial intelligence. So under that, the next umbrella term is machine learning. Then under that, deep learning. Under that, now we are having generative AI, artificial intelligence. So what is machine learning? So it is a system that learn from data without explicit programming. Because already we are having the computer-aided drug design system, like talking on many things, molecular dynamics, pharmacophore mapping, QSA, many things are there. But everywhere you have to write the program, you have to give the program, you have to write the program for each and every process. If you are writing program for one process, that will work for that particular model only. So next model you would write the another program or another things. But in machine learning, here by using the data you have to train the machine. Then the machine will train with the data. Then it's able to predict the unknown data. That is the advantage of machine learning. For example, machine learning simple. You can take the multiple linear regressions, support vector machine. So all these things are example for the machine learning approach. Then deep learning. So here, first you have to train the machine. Then the machine means here I am talking about the computer. Then the computer will predict the activity. But here we are not going to use the data to train the things. So automatically the system means the techniques, the deep learning techniques, automatically it will extract the information from the data. That is called as unlabeled data. Here we are going to use the labeled data. Here we are going to use the unlabeled data. Yes, here we are not going to train the machine. So it automatically go through the information, whatever it is there, then it will extract the information. So it will work like how our brain will work when it is getting the impulses, how it is getting the impulse and how it is processing. The same way it will work. So only the name is neural network with multiple layers mimicking our brain structure. The next one is computer vision. So analyzing and interpreting visual information. So here it is visual information. If you are having any visual information, how the computer is going to analyze and interpret it. Then knowledge representation, storing information in machine interpretable form. Yes, morning itself, Dr. Jaykant told that. So the computer will read the binary numbers, means 0 to 1 only. It will not identify A, B, what it is. So you have to store the information in machine interpretable form. Then robotics. So robotics, actually the robots will not come under artificial intelligence, but when it is incorporated with the artificial intelligence system, then it will be, because the robotics, it is just like a physical machine. So it is a machine, so it will do whatever we are instructing. That is the common function of robotics. But when the artificial intelligence system is incorporated with robotics, but so only nowadays it is the robotics are used in many places, like it is doing operation, it is doing dispensing, and recently I have seen in Japan they have conducted Japan or China, they have conducted football match by using the robotics. Yes, everywhere they are using the artificial intelligence system incorporated with the robotic system. Then this is the most important thing, natural language processing. It is one of the generative AI techniques. So understanding and generating human language. For example, the ChatGPT, one of the best examples where they are using this natural language processing is the ChatGPT. Just you are giving the prompt, I want the article related to anti-cancer. and the truck should contain queen and in ring or something. You have to give the proper prompt. Then it will give all the information about whatever you are asking. That is the things. Means it will listen. First, it will listen what we are asking, then understand, and it will give the decision. So that is called as natural language processing. This is mainly used in many places. For example, many of you are wearing that iPhone. The iPhone, one option is that is Siri. So when you are asking something, immediately it is replying. So that is one of the process where we are using the natural language processing. So machine learning, the foundation of modern AI. So this is the basic of the modern AI system. So here, everything is based upon the data. If you are giving the reliable data, then you will get the reliable model or reliable decision. If the data is not reliable data, it is a manipulated data, then the output is also will not be correct. So we ought to be very careful about the data. So that is the most important thing. That is we can tell it is the fuel for the artificial intelligence. So the artificial intelligence will work totally based upon the data. Whatever the data, whether it is a structural data or medication data or clinical data or any other data, even agri-field engineering, whatever the data we are going to give, based upon that only the AI will work. So the data is most important. So only it is called as the fuel of artificial intelligence. So the data input, so raw information is collected, cleaned, and processed. Then algorithm selection, mathematical approach best suited to the problem. Just now I told multiple linear regression, partial list regression, support vector machine. So there are different algorithm techniques are there. So you have to select which one is the best one. Then the training process, algorithm learn patterns from the examples, whatever we are giving here. So based upon that, the system will learn first. So only it is called as machine learning. First, the machine will learn, then it will do the prediction. Then model evaluation, testing accuracy of new data. So first we train the data with the sample, then we can use new data for the prediction. Then they use model applied to real world problems. So learning approaches, just now I told, there is supervised and unsupervised learning. Supervised learning, we have to use the labeled data to train the machine. Then it will predict. But when you are using unsupervised data, the machine is not going to train. So automatically it will extract the information, just like when you are doing the clustering. I think many of you have known about the clustering of the data. Suppose I'm having thousands of data, in that male, females are there. So how we are going to separate? So based upon male one group and female one group. So that is clustering, how it is going to cluster the things. That is called as unsupervised. Here, nothing is labeled. But the supervised learning, we need the labeled data. For example, you are having 20 compounds and its activity. Like that, you should have the labeled information. Then next one is the reinforcement learning, learns through trial and error with rewards. So this is the main technique where we want to do any optimization. This is one of the technique what we are using, reinforcement learning. That is to optimize the things. Suppose I'm having 100 structures, I have to optimize its log p value. Then I have to use this one, reinforcement learning method. And the other important thing is in machine learning, we are going to handle somewhat big data. It is not the real big data, it is medium data. Suppose as a human, we can handle 100 data or 200 data. So when you are going for machine learning, it is 500, 600, 700. But when it is very big, then the machine learning will not handle that one. So we have to go for deep learning. So very big data will be handled with the deep learning techniques. So here they are using the concept, the neural network, how the brain will receive the information and how it is giving the solution or decision, how it is making the decision. So like this. So architecture is inspired by the human brain's neural structure. So input layer receives the raw data. So already I told the data is the most important things in whatever the AI techniques you are going to talk, the raw data is important. So hidden layers, so multiple layer extract progressively complex features, then output layer produce final prediction. So the key advantage, automatic feature extraction. It's not like the machine learning, we have to train the machine, then only it will predict. No, here automatically it will extract the future information, then superior performance on complex tasks. That only I told you. When the data is very big, then we have to use deep learning techniques. Ability to handle unstructured data. Because in the machine learning, we need the structured data. Capacity to learn from massive database. That only already I told, very big database we need. So deep learning has revolutionized image recognition, achieving superhuman performance in tasks like cancer detection from medical scans. So this is the important things, as I already said, natural language processing. It means, suppose I am talking in English or Tamil, I don't know Malay, but I want the information from the Malay source, or suppose I don't know Hindi. So I want the information from Hindi, but I know only Tamil and English. So I will use my language and I will give the prompt. Then it will extract the information from the resource, which was actually in Hindi, and it will convert the language to our language. So whatever you are asking, it will listen and do the things, means solve the problem, and it will give the decision, it will give the output. That is called as natural language processing. That is the best example is just now I told the ChatGPT. So the core capabilities, text classification and categorization. Then named entity recognition, sentiment analysis, machine translation, question answering, text summarization, and information extraction. That is the important, most important things what we are going to use when you are integrating traditional system with the modern medicine. Because already I told, in traditional medicine there are a lot of empirical values, means experimental informations are there based upon the experimental data and their practice. So all the information we want to integrate with our modern medicine, it's not possible by human. So all the information we want to collect and extract the information, then we have to use this technique, natural language processing technique. So NLP enables machine to understand, then interpret it and generate human language, bridging the gap between computation and linguistic domains. That only I told, whatever the language, the linguistic, it will help. Suppose maximum when you are seeing the Chinese people, they don't know English, they know only Chinese. So they are using a lot of app which is made up of with this natural language processing. So whenever we are talking in English, it will convert that talking matter to Chinese for them. So they are having that hearing aid. So that is the important things for the natural language processing. Then this was the things what I told, the data, the fuel for AI. So how the data you are having, that much accuracy will be there in the prediction. So there are 2.5 daily data creation will be that. That is EP is nothing but exabyte. That is equivalent to 2.5 billion gigabytes. So that much daily data creation will be there. And healthcare data, in that healthcare data is 33 zettabytes. So in that 80% is unstructured data. Unstructured data means it is not properly labeled. So the efficacy of AI system depends critically on the quantity, quality, and diversity of the data used for training. So the important thing is quantity as well as quality, not only quantity or not only quality, both are important. And diversity of the data used for training. For pharmaceutical application, this includes chemical structures, genomic sequence, clinical trial result, electronic health records, and traditional medicine documentation. All this we need for pharmaceutical application. I think just now Dr. Jaikant discussed about what they are doing in their laboratory. So the chemical structure information by using from the database, how they are extracting the information. I think he has selected 16 million compounds. From that 16,000 compounds to reduce to 569 or 68. So how it is reduced? It's not, we cannot do by human, or we cannot do with simple computational technology. So we need a speed process within a day or within an hour. They have done that one. We are using the AI tool. That is one of the tool is natural language processing. So AI in healthcare, that the current landscape that is used in clinical decision support, medicinal imaging, drug discovery. I think morning Dr. Jaikant discussed about this one, drug discovery, and operational efficiency, patient engagement, and population health. So the healthcare AI market is projected to reach $45.2 billion by 2026, with growing rate of the component average growth rate is 44.9%. So why AI for pharmacy? Already I told we are having lot of data. There is lot of complication because when you are taking one drug, the drug itself, there is a pre-formulation, then structure, then it is its structural information, it is physicochemical properties, then preclinical data, clinical data, and lot of other data, drug interaction, side effect. We are having lot of data to handle. It's not that much easy by a human or by simple computer. So that handling the complexity, so we need AI. So pharmaceutical research involves astronomical complexity. That is, we are having 10 to the power of 60 potential drug-like molecule. 10 to the power of 60 potential drug-like molecules. So one molecule you think, then you think about 10 to the power of 60, how many data we are having. Then 20,000 plus human genes are there. Here we are having very small molecule, but think about the genes and enzyme, protein, all other things. Then countless interaction. Yes, protein-protein interaction, drug-protein interaction, drug-drug interaction, herbal drug interaction, food-drug interaction. There is a lot of interactions. So AI can navigate this vast space systematically. That is the advantage when we can use, why we have to use AI in our pharmacy field. Then accelerating research, as you all aware that just now in the beginning slide I told, when you want to develop the drugs, you have to spend 10 to 15 years, and you have to spend more than $2.6 billion, and the manpower on a lot of things are there. So everything will be, when we are using AI, everything will be dramatically reduced to 30 to 50% when we are using the AI. So we need AI in our pharmacy. So improving outcomes. So AI enables personalized approaches to medication considering individual genetic profile. That is precision medicine, comorbidities and preferences, potentially improving efficacy while reducing adverse effect. That is the main thing. So all the way we have to reduce the side effect, but improve the efficacy and potency. So there we want to improve the outcomes. There also we need AI. So these are the reason why we are using AI in pharmacy. So the AI in ancient medicines. So the relationship of traditional knowledge and modern practices. So the integration of AI with traditional medicine represents a paradigm shift in how we approach drug discovery and personalized healthcare. The first one is moving from reductionist to system-based approach. So moving from reductionist, because earlier it is the whole process. Then we started with the reductionist. The reductionist means it is a complex process. You break down into small things like system-based. Then it will be easy. That is the thing. Moving from reductionist to system-based approach. Then leveraging empirical wisdom accumulated over centuries. Because already I told there are a lot of knowledge is there, empirical knowledge is there from each and every traditional concept. So we have to use that one over the century, whatever it is that we have to use that one. The next is validating traditional formulation with modern techniques. So earlier already told it's not properly validated. So you have to use modern technique and do the validation. I think morning Dr. Mahadevan sir discussed about how to do the extraction, how we are going to use the AI there, and how to do the isolation. All the places we can use the AI in different way. So preserving valuable cultural knowledge at risk of being lost. So this is another important thing. You have to preserve the valuable cultural knowledge. Yes, it is already more than centuries. So we have to preserve the things. We have to save the things. So another scientist, another Nobel Laureate, Dr. Tu Yu, that is winner of the atom sin discovery from cesium, who has invented the atom sin track from plant. So he told the future of medicine may well be found at the intersection of ancient wisdom and modern technology. So that is the things what I'm talking today. We have to intersection means you have to connect the ancient wisdom with the modern technology. Yes, we are having enough resources here in ancient wisdom. Many things, more than 85%, it is not explored. So we have to explore all those things with modern technology. So it will be easy. That modern technology means now we can take AI, where AI serves the translator between this seemingly desperate world. So digitizing ancient text and knowledge. So already I told we are having enough resource, but it is in different language. It is in the written form. It is not in the digital form. So we have to make it everything digitizing. That is digitizing ancient text and knowledge bases. So the world traditional medical text contain millions of pages of information, much of it in handwritten, in extinct language or dialect. Okay, it is in different language or different format like image or some other things. So we have to convert all these things to make it digitization. So AI powered digitization process. So article character recognition. So that is one of the option in AI, that is converting physical text to digital form. Handling ancient script and deteriorated manuscript. For example, you can see because it is thousands of years old. For example, you can take Ayurveda. It is 5,000 years old. So definitely we cannot get the nice or proper book, whatever they have written, book or any other format. So it may be deteriorated. So it deteriorated manuscript. How we are going to extract the information? So for that, you have to use optical character recognition. Then already I talked much about this, that natural language processing. So translating, interpreting, and structuring knowledge from the ancient medical text. The next one is knowledge graph construction. You have to construct the graph. So creating the relationship between herbs, symptoms, disease, and treatments. So you have to compile all these things. Then next is the searchable database. So making centuries of knowledge accessible to researcher globally. Just now morning, Dr. Jagan told there is a lot of database, PubChem, PubMed, Zinc database. There is a lot of other databases. So like that, we have to make this one as the database which is useful for the researchers to do the further research and to explore the remaining 85% of the unexplored information from the traditional medicine. So we can use the AI, which make it easy, the process easy. Then cheminformatics and phytochemistry. So compound identification. So where we can use AI. So AI algorithm analyze mass spectrometry, NMR nuclear magnetic data, and identify active compounds in traditional herbs with unprecedented speed. That is the important things what I told in the starting of my talk. The two concepts now, the main two concepts of AI is, one is to make it fast. The another one is to reduce the cost. These two are the important things at present, but there are a lot of research is going on to improve its capacity to do to improve our process. So with unprecedented speed and accuracy. Example, identification of 150 bioactive compounds in ginkgo biloba using AI enhanced metabolomics. So this is one of the example where they have used AI to find out the phytochemistry, constituents of the ginkgo biloba. Then structure prediction. There also we can use the AI technology, particularly their deep learning models predict 3D structure of phytochemicals from partial data. Suppose we are not having, we are morning, Dr. Mahadevan sir discussed about the talking studies. So when we are doing the talking studies, you have to download the PDB structure from the protein data bank or any other data bank. If it's not available, the protein structure is not available, but we need the protein structure. So we can use the information that comes on the amino acid sequence, and we can construct the 3D structure of the protein. So for that, we can use the deep learning technique. So one of the deep learning techniques, this is AlphaFold. That is one of the techniques which is used to develop the protein structure, 3D protein structure, not structure. It is a 3D protein structure where when we are going to do docking studies or dynamic studies, we need the 3D structure of the particular protein or enzyme. So it is easily developed by using the sequence. Once we know the sequence information, then we can construct our protein by using the computation technology. That is AlphaFold technology. So the next is activity prediction. So the activity also will be predicted by using different technology. One of the technology is quantitative structure activity relationship. So this it is one of the machine learning methods. So first you have to develop the model by using the test sample. Once it is developed, then you have to validate the model. Then the validated model will be used for prediction of the activity. So same thing, we can use it in our synthetic medicinal chemistry, but same thing will be used in the phytochemistry also, the traditional medicine also, because already we are having the structure and its activity, so we can easily develop the model and do the prediction. Not only activity prediction, in toxicity prediction also we can use this one, or property prediction also we can use QSPR. So example, predicting anti-inflammatory activity of 50 plus traditional Chinese medicine compounds with 85% accuracy. Already the studies has done. They have used 500 plus TCM compounds for this study by using QSPR. They have predicted the anti-inflammatory activity. The accuracy is near about 85%. Then target prediction and mechanism elucidation. Not only the property or identification or structural prediction, it is also used in target prediction. Means suppose I'm having the compound. This compound is going to interact with which target? Because there are a lot of targets. Just now you have seen there are near about 20,000 genes are there in our body. So which gene or which protein or which enzyme it is going to interact. So you have to predict the target. Then only we can confirm that particular drug is used for the particular to treat the particular disease or not. So that is one of the challenging process in the drug design and discovery. So traditional medicine often work through multiple mechanisms simultaneously, a paradigm poorly suited to conventional single target drug discovery approaches. So AA enables systematic exploration of multi-target effect of single compound. Already I told, whenever you are taking any compound, it is made up of the functional groups. So it's not only going to interact with only one receptors. It is going to interact with multiple receptors. Whether suppose my drug is having hydrogen bond donor, definitely whenever the receptor is having hydrogen bond acceptor, definitely it is go and interact with that if it will fix in the active site. So that we can find out by a drug technology, multi-target or single drug will interact with multiple target, different target. Then synergetic interaction between compounds. Suppose one drug you are taking along with that the another drug, whether it is going to give the synergetic effect or a degenergetic effect. So we can find out that one also. Then network level impact on biological system as a network. That is, we can easily find out what are the target responsible for the particular disease, and your drug is going to interact with all the target or not. That is network pharmacology. We can tell network pharmacology. Then personalized response variation. So person to person, the genetic information is different because I am having different genes and the another guy is having different genes, the third guy is having different genes. So how we are going to do the medication according to the genetic information, that is called as personalized medicine. So recent advancement in AI-powered polypharmacology have identified that many traditional remedies work through network pharmacology, modulating multiple targets simultaneously to achieve therapeutic effect with minimizing side effects. So next one is standardization and quality control of herbal products. So already I told this is the major problem in the earlier system because they have prepared the formulation, they have utilized. They didn't do any standardization, they didn't do any quality control. So we don't know what are the drugs are there, what is the quantity it is there, whether it is going to give beneficial effect or non-beneficial effect, all these things. So we have to standardize it and you have to do the quality control also. There also we can use the AI system in different form. One is computer vision for authentication. Suppose I want to identify one plant, I'm having the plant A, but I don't know what is the plant. So we can use that characters and match with the, suppose we are having the photograph of that plant. Then that photograph will be matched with the thousands of already stored information because already I told we are having lot of resources in traditional medicine. So it will matched with the particular on the plant whatever I'm giving, it will be matched with the thousands of data. Then it will find out it is matching with which plant and what is the what will be the biological constituents and what will be the uses, all these things. So AI powered image analysis can identify medicinal plant with greater than 98% accuracy, even distinguishing between closely related species and detecting the adulterant. Yes, this is one of the major issue what we are facing now, not only in pharma field, in other field also. Even when we are going to buy the grocery also, this is the major issue, adulterant. So we can easily detect the adulterant. So example, DeepHap, that is one of the AI system identifying 253 Chinese medicinal herbs from photograph with 95% accuracy. This is the advantage of AI. This is the AI technology, DeepHap. Then next one is spectral analysis for composition. So whenever you are having any tricks, it will be it means you have to identify the structure by using different techniques like near infrared, FTIR, Fourier transform infrared spectroscopy, Raman, mass, NMR, whatever it is, all the spectroscopical techniques to doing the interpretation, it is very difficult. So we can use the AI techniques here. So neural networks analyzing near infrared spectra to determine ginsenoside content in ginseng product. So now another one is hemometric fingerprinting. So AI algorithm create characteristics fingerprint of authentic herbal preparation, enabling rapid identification of the substandard or counterfeit products, whatever the product it is, which is not the one real one. So example, support vector machine, that is the machine learning technique, support vector machine classifying traditional Chinese formulation based on chromatographic profiles. That is one of the example. Then AI driven formulation optimization. Not only all these things, we can use AI in formulation optimization. So how we are going to use this one? The first one is genetic algorithm, evolving optimal combination through iterative breeding of formulation variants. So we can go for the combination optimization by using genetic algorithm. Next one is Bayesian optimization, which is efficiently exploring vast formulation space with minimal experiment. The next one is reinforcement learning. Already I told the reinforcement learning is one of the best technique to do optimization. So here training model to optimize formulation through simulated experiments. So it is mainly used for optimization. Then network pharmacology, just now we have seen, it is used to find out the multiple target where it is going to interact with. The particular drug is going to interact with what are the targets. Then these approaches have successfully optimized complex formulation like Yupingfen, that is traditional Chinese medicine, and Triphala, that is Ayurveda medicine, for specific therapeutic outcomes. So traditional formulation often contains dozens of ingredients in precise ratios. That is the complexity where we can see the complexity that challenges conventional optimization approach. When we are using the conventional approach, it's very difficult because already I told there are dozens, there are not only dozens, there are number of ingredients will be there. When you are taking any traditional formulation, whether it is TCM or Siddha or you can take Ayurveda, there are number of ingredients will be there. So when we want to do optimization, it's very difficult when we do ourselves. Then clinical validation and efficacy studies. There also we are going to use the artificial intelligence. So trial design optimization. When we want to take the participants for clinical validation, means clinical trial. So how we are going to select that data? What are the inclusion criteria? What are the exclusion criteria? So everything will be done by the AI from the already available resources. It will go through and it will decide what are the inclusion criteria, what are the exclusion criteria, and what will be the endpoint of traditional medicine trials. This approach has reduced failed trials of TCM formulation by 30% in pilot studies. Then real world evidence. So NLP means natural language processing, and data mining extract efficacy data from electronic health records where traditional medicines are already integrated into healthcare. So already it is integrated. So from there, we are having, there is number of electronic records. So sitting and reading, it's not possible for ourselves. So we have to use this natural language processing. So example, analysis of 50,000 plus patient record from integrative medicine clinics in China, identifying efficacy patterns. The next one is biomarker. So biomarker, I think already you all aware about the biomarker. For example, disease, which is responsible, which one of the compound which is particularly responsible for the disease, that is called as the biomarker to make it whether the disease is there or not. Then machine learning identifies novel biomarkers that correlate with traditional diagnostic categories, that is Ayurveda, those are TCM patterns. Example, machine learning identified inflammatory markers corresponding to the specific TCM syndrome differentiation. Then personalized traditional medicine with AI. So personalized, already I told, when it is going for the individual treatment, that is called as person or precision medicine. Means now we are telling it is a precision medicine. Means according to the genetic information, we are going to give the treatment in modern technology, that is precision. Earlier, we have gone for individual treatment. In traditional medicine itself, there are different types of them. So the traditional medicinal system inherently embrace personalization, that is Ayurvedic Prakrit, that is constitutional types, then DCM symptom, then Unani Mesa. So these are the some philosophy where they have followed to give the personalized treatment. AI enhances this personalization by quantifying traditional diagnostic parameters, correlating with the modern biomarkers, predicting individual response to traditional therapies, and optimizing formulation for specific constituents. So modern application include AI systems that analyze facial features, pulse waveforms, tongue images to determine TCM constitutional types with 89% agreement with expert practitioner. So challenges in integrating AI and untuned system. Yes, we are telling it is easy. Just now, about 40 slide I talked, just you can interpret the AI, so it will do. But there is also a challenges are there. You have to face those challenges when you are integrating AI with the ancient knowledge. The first one is data scarcity and quality. So already I told the quantity and quality is very much important. So data scarcity means there is not enough quantity of data is there, and the quality is also not there. Then how? So limited digitized resources from traditional system. So what you have to do? You have to make it digitized. Yes, already it is in written form or in the book form or in the image form. So you have to extract the information and make it digitized. Then lack of standardized terminology across tradition. Then incomplete or ambiguous historical documentation. If it is incomplete, then we cannot use that one. If it is ambiguous, because it's not able to understand, it is vacuum. So that we have to, that is the challenging in when we are doing the integrating AI with ancient wisdom. Then ethical and intellectual property concern. So biopiracy and exploitation of indigenous knowledge. Yes, the knowledge is to particular community or particular society or something. So when we want to make it commonly available to the world, so we have to see the ethical concern and intellectual property rights, because it is mainly to the particular region people, that indigenous knowledge. So equitable benefits sharing with knowledge holders. Tension between the open science and IP protection, another important information. Then methodological gap. So incompatibility between holistic paradigm and reductionist science. Then difficulty modeling complex multi-component interaction, incorporation of subjective diagnostic parameters, then algorithm bias, under representation of non-Western medical data, cultural biases, and risk of perpetuating historical bias. So success story of AI and traditional medicine. So just now we have seen the AtomSynth development. Yes, earlier also the AtomSynth development was there, but the yield was very less. But when they have incorporated AI technology in how they have extracted the AtomSynth from Atomcia annua, so the yield is increased to 30%, 37% increase in AtomSynth yield and reduced production cost. Means in the synthetic process also they have used the AI process to synthesize the compound. So when they have used AI, there is a 37% increase in atoms in yield and reduced the production cost also, because it will reduced some steps. Instead of 5 or 6 steps, it will be in 2 steps or 3 steps. So it will reduce the production cost also and increase the percentage of yield. Then Ayurvedic type prediction, machine learning algorithm developed at AIIMS, that is in India, can predict Ayurvedic Prakrit from genomic data with 85% accuracy. So outcome clinical trial initiation for Prakrit specific treatment protocol is going on. Then traditional optical medicine database. So they have used NLP. NLP, natural language processing, powered analysis of ethnobotanical literature, created a search database of 3,000 plus African medicinal plants and their documented uses. So outcome, identification of 17 compounds out of 33,000 compounds. They have found out 17 novel lead compounds for tuberculosis treatment when they have checked 3,000 compounds by using natural language processing. Then modern frontiers, that is AI in drug discovery and development. So this is the traditional challenge and the revolution from AI. So already we know all this process, it will take 10 to 15 years. You have to spend 2.6 millions. There will be more than 90% failure. Then limited exploitation of chemical space. So potential, when we are using AI, it will reduce 3 to 5 years. Then up to reduction on the cost reduction will be up to 70%. Then improved candidate selection, reducing clinical failure. Then orders of magnitude, greater chemical space exploration. Then target identification and validation, finding the right biological target is critical. So historically, poor target selection to select the correct target. So we have to use AI approach, that is already we have seen network pharmacology, multi-omics integration. So multi-omics means we can use proteomics, genomics, metabolomics, then literature mining by using NLP, then phenotypic screening. So de novo drug design and synthesis prediction. De novo means de novo is nothing but from the beginning, without knowing anything about the disease or the ligand. So you have to design the drug de novo. Once you have the information about the target, then you have to design your drug by yourself. So there we are going to use some technologies, that AI technologies. One is variational autoencoders and generative adversarial networks can create novel molecular structures optimized for specific properties. So these are the techniques where it will create the novel molecular structures. So we can use any one of this technique. Example, in silico medicine, that is one of the AI techniques. Sorry, one of the company where they are using the AI technology. Central platform designed, synthesized and tested a novel DDR1 kinase inhibitors in 46 days versus traditional timeline of 2 to 3 years. So within 46 days, they developed the DDR1 kinase inhibitor by using these techniques. The next one is reinforcement learning for optimization. So already I told reinforcement learning is mainly used for optimization. So it will be used for optimize molecule for multiple parameters simultaneously, like potency, selectivity, solubility, all other properties we can optimize simultaneously, means at a time, by learning from simulated experiments. So example, the existential AI platform designed DSP1181 for OCD treatment, which entered clinical trial in 2020 after just 12 months of development. Because all the optimization when they used this Scientia AI platform, it took only 12 months to do all the optimization. Otherwise, in the conventional method, it will take 2 to 3 years. Then retrosynthesis, not only this, in the synthesis also we can use it, but it's also retrosynthesis. AI system can propose viable synthetic routes for novel compounds, ensuring decent molecule can actually be produced efficiently. Example, MIT molecular transformer can predict reaction outcomes with 90% accuracy, enabling more efficient synthesis planning. Then virtual screening and lead optimization. Virtual screening is nothing but when we are having more number of compounds, it's not possible we have to sit and do one by one. So at a time we can do all the compounds, we can screen against particular target. So that is called as virtual screening. By all the compounds are in digital form. It is not in the synthetic form or already synthesized. It is in the digital form. So by using the software and AI technology, we can do the virtual screening. So traditional computer like docking, one of the techniques which is used in virtual screening, pharmacophore mapping, QSAR, any one of the techniques we can use it for virtual screening. So traditional computational screening evaluate 1,000 to millions of compounds. AI method means 1,000 to millions, but if you are having more than that, then you have to use AI method enable screening billions of virtual compounds. Okay, we can use the docking studies, we can use the pharmacophore, QSAR modeling to do the virtual screening, but the process is very slow and it will take a lot of time, and maximum you will go for thousands or 10,000, 20,000 or millions compounds. But when you are using AI, we can go for billions of compounds. More accurate binding affinity prediction. Then consideration of protein flexibility and dynamics. We can do both docking as well as the molecular dynamics. Then evaluation of novel chemical scaffold. So deep learning methods like AtomNet, that is one of the deep learning method, have demonstrated the accuracy improvement of 50% over traditional docking approaches. That is one of the technique, AtomNet. Then multiparametric optimization. So AI excel at navigating complex trade-off between competing molecular properties like potency, selectivity, metabolic stability, permeability, solubility, membrane penetration, and efficacy, toxicity. So we can optimize the multiple parametric optimization. Then the ADME prediction, I think no need to tell, because morning Dr. Mahadevan has discussed enough about these things. So here also we can use the AI technique to predict the ADME prediction like Protox. There is a lot of softwares are there, and the Swiss ADME is there, Protox is there, Cox2, so Cox by something it is there. So we can use any one of this online tool and do the prediction. So clinical trial design and patient selection. So optimizing trial design, so that is synthetic control arms, reducing placebo requirements. Synthetic control arms means the software will develop what you can tell, the placebo. Instead of placebo, we can select the virtual placebo techniques, means from the information from the older data, the already available data, the AI will extract the information and it will create the virtual placebo. So that is the things which is called as synthetic control arms. Then adaptive trial design responding to interim result, biomarker identification, optimal dosing, and protocol optimization. So machine learning algorithm improve patient matching by identifying likely respondent from biomarker profile, predicting adherence, optimizing site selection, reducing heterogeneity, and these approaches have demonstrated 50 to 30% reduction in clinical trial failure rates in oncology and neurology studies. Then pharmacovigilance also, we can use the AI technology and in drug repurposing. So AI enhanced pharmacovigilance. So the traditional adverse event monitoring relies heavily on spontaneous reporting. So automated signal detection from diverse data sources, then real-time monitoring of social media and patient forums, then natural language processing of case report, identification of vulnerable patient subpopulation, then prediction of potential adverse events before clinical observation. So all these things we can do with AI. Then systematic drug repurposing. So drug repurposing, I think already you all know that. So already FDA approved drugs are there, or the drugs which is crossed clinical trial 2 or 3, but it is not in the market. All these drugs will be repurposed for some other disease. Because, for example, drug A is there. It is mainly invented for hypertension, but later on the scientists found out it is used for cancer treatment. This is called a drug repurposing. So they have to do some modification and completely abolish the activity of the first activity, then improve the potency against the cancer. That is called as drug repurposing. Means the same drug will be utilized for other purpose. So what will be the advantage in drug repurposing? When we are doing drug repurposing, so no need to go for clinical trial 1. So no need for that. BIAS already it is done, and many of the optimization techniques no need. BIAS already they are done for the already approved FDA drug. So finding new uses of approved drugs can save 5+ years in development. So AI approach include transcriptomic signature matching, network-based similarity analysis, target-based screening across diseases. So for example, the Benevolent AI, that is one of the AI tech company, identified parasitinib for COVID-19 treatment in early 2020. So early 2020, so they have found out this drug parasitinib is best option to treat COVID-19 by using by this company Benevolent AI. So the real world evidence and post-market surveillance, so data integration from diverse source, then effectiveness in diverse population, long-term safety monitoring, and health economic outcome research. So these are the some evidences. And the future of pharmaceutical pipeline. So in 2023 to 2025, there is widespread adoption of AI for target discovery and lead optimization. Mainly it is used in these two areas, target discovery and lead optimization. First, fully AI designed drugs receiving regulatory approval. So already one of the drug, it is already approved by AI. Then integration of traditional medicine database into mainstream discovery platform. The next 25 to 30 in silico clinical trials reducing phase 1 safety studies by 50%. And fully automated synthesis and screening laboratories, personalized dosing based on digital biomarkers, then quantum computing enhancing the molecular simulation accuracy. In 30 to 35, there will be a drug development timeline reduced to 3 to 5 years instead of 10 to 15 years. Then continuous manufacturing with real-time AI quality control, digital twins or virtual patient testing. Digital twin is nothing but now when we are doing the clinical trial, we are using the patient. So the same way just now what I told for this one, what is that? 1 minute. Here, synthetic control arms. So here synthetic control arms, from using the old data, it is going to develop the virtual classifier. Same way, here it is going to create the virtual patient. That is called as digital twins. When it is, you are developing the patient virtually, that is digital twins. So complete integration of traditional and modern pharmaceutical paradigm. Then smart solution AI in personalized medicine or precision medicine. Personalized medicine represents a fundamental shift from one size fits all approach to healthcare. So right treatment for the right patient at the right time. That is the concept of personalized medicine. So prevention rather than reaction to disease. Continuous monitoring rather than episodic care. Patient as active participants rather than passive recipients. So when we are AI serves as a computational engine enabling this transformation by integrating multi-omics data like genomics, proteomics, metabolomics data, processing real-time monitoring, analyzing environmental and lifestyle factors, interpreting complex interaction pattern beyond human capacity. So it is also used in diagnostic and prognostics. So I don't want to read all these things. So it will be used in radiology, pathology, dermatology, and cardiology for the diagnostic purpose. In prognostic purpose, to find out the disease onset, disease progression, treatment response, and relapse risk. So it will be, the AI is used in all this area. So drug adherence and medication management. So we can find out the non-adherence rate also by using AI data. So where the patient are not following the medication as prescribed. The AI in pharmacy operations, so it is used in dispensing. We are using the automatic dispensing by using robotic technology. Then inventory optimization. Inventory optimization means in particular hospital, suppose you are in a Trichy. The Trichy area, they are mainly the antiviral drugs are moving fast. So AI will analyze the data earlier 4 or 5 years data. Then it analyze this is the month of August. In the month of August, what are the trucks was sold highly in this particular area near the Periyar College? How much trucks are sold? What are the trucks? So analyze it. Then it will give the idea these trucks should be purchased for this month. Then in the month of January to March, what is the trucks having very good movement? So that inventory optimization will do by AI technology. Then compounding verification, whether when you are doing compounding, whether the correct truck is prepared and dispensed, that will be verified. Then workflow prioritization also will be done by the AI technology. Then patient education and support. So conversational AI, natural language chatbot provide 24/7 access to medication information, answering question about side effect, interaction, and proper usage. That is the advantage of chatbots. Just you have to ask your question, immediately the chatbot will answer for your question. So no need for the human intelligence here. So automatically everything is chatbot will know. So whenever you are asking, the chatbot will give answer for your things. So example, MedPalm2 by Google answering complex medication question with 92.6% accuracy, approaching physician level performance. That is one of the AI tool in Google. That is MedPalm2. So personalized education. So AI tailors medication information to patient health literacy, preferred learning style, and specific concerns, improving comprehension by 40% in clinical studies. Then virtual recognition tools. So computer vision application helping in patient to identify pills, because sometimes it's very difficult for them to identify the pills. So based upon the color or the size, the AI will help them to identify which cell, which is the drug they have to take. So example, Meta system reducing medication errors in hospitals by 60% through visual verification. So this is the another AI system, that is Meta system, which is mainly used to reduce medication errors. Then telepharmacy and remote patient. So telepharmacy, we all crossed this one because during the pandemic duration, 2020-2022. So we have gone for this telepharmacy only, that is played a major role during the COVID-19 period. Then virtual medication therapy management, remote vital monitoring, computer vision verification, and voice biomarker analysis. For example, virtual medication therapy management, AI facilitated consultation identifying drug therapy problem. Then remote vital monitoring, because some of the areas, because when you are in Trichy main area, you can get all the facilities. So if you want to do some testing, you can go to the lab or hospital immediately. But the village which is far away from the Trichy, so they want to do the testing and they want to give the data. It's not possible all the way. They have to come for just for example, we can tell glucose testing. It's not possible for them to come each and every time. So what you have to do? You have to use the algorithms, AI incorporated glucose diagnostic machine, which should be implanted with them, so we can easily monitor it. So algorithm detecting medication effect through wearable device like the smartwatch, how we are detecting the blood pressure and the blood sugar level and the pulse rate. Everything will be detected easily by the smartwatch. So that smartwatch will be connected with the hospital or clinic, so they can easily monitor the patient. So the pharmacist evolving role. So traditional role, medication dispensing and basic counseling, limited clinical involvement and reactive information provision. Then current transition, medication therapy management, immunization, then collaboration with AI tool for operation. Emerging role, clinical decision support, data interpreter, then AI augmented care coordinator. Future vision, medication precision specialist, multimodal therapy integrator, health technology. So the ethical, so already they have discussed much about this ethical. So the privacy and security is important. Yes, we are going to data from different people, so the privacy is important for them. So with enabling beneficial AI application, then fairness and equity, transparency and explainability, autonomy and human oversight, accountability and responsibility. So these are the different area where we have to take concern when we are using AI healthcare. Then regulatory. So this will be regulated by regulated by Food and Drug Administration, European Medical Association, and World Health Organization. Now at present, these are the three organizations which is controlling or regulating the usage of AI. So the human element, it is one of the important thing. We use it for collaboration, not for replacement. So don't think that there is the replacement for human. It's never. Yes, until it will think by him itself. Because now the AI is working based upon the earlier data. Whatever the data we are giving, according to that, it will extract the information. Then it's work according to the what the data we have given. But once it start thinking by itself, like how we are thinking. Suppose, for example, one surgeon is doing the surgery. Suddenly, some unwanted things happen. So immediately, as a human, we can think in different way how to solve the issue. But when the same operation surgery done by the robot, which is incorporated with AI, so it is doing the same surgery, but some unexpected things happen, which is not usual. So that's all. The thing, the robot is not going to think in different way. It is whatever it is fitted, according to that only it will work, but it will not like human. So it's not going to be the replacement for human until it will think by itself. So the empathy, intuition, ethical judgment, creative problem solving, and therapeutic relationship, all where it is will be collaborative only. So future outlook, the synergy continues. So we are going to now the quantum computing power is came. So it will be the process will be faster than what we are having now. So significant pharmaceutical application by 2030, 35 will be the quantum computing revolution will be there. Then hyper personalized therapies. So convergence of AI, synthetic biology, additive manufacturing will enable on demand creation medication tailored to individual genetic profile. Then preventive medicine transformation. So multimodal AI integrating genomics, continuous biometric monitoring, environmental sensing, and behavioral analysis will shift healthcare focus from treating disease to maintaining optimal health through predictive intervention. So call to action for pharmacy profession. So continuous learning is important, not only the today things, today it is different, tomorrow it is entirely different. So the AI technology is improving like anything. So each and every day we are getting new information about AI technology. So the continuous learning is most important. Then interdisciplinary collaboration, that is one of the important things, because AI, they are developing by engineers. Then we know about the pharmacy, about the drug. The doctors know about the disease, and the chemists know about the chemical structure. So the integration, interdisciplinary collaboration is most important whenever you are doing this type of work, when we are transforming the medication from traditional medicine to the modernized medicine. So the interdisciplinary collaboration is most important thing. Then suppose if you are doing some indigenous medicine with the modern medicine, then you have to include the community which is doing that indigenous mitigation, then engage in research, then set the future. So the convergence of ancient and modern. So holistic versus reductionist. Holistic, already I told, it is the whole body treatment improvement. Then reductionist means we have to split into small part, means system based. Then empirical and evidence based. Empirical means it is a full experimental. This is evidence based, the recent modern medicine. Then personalized and population based, intuitive and algorithmic. So case study, so AI driven discovery from Ayurveda. So one of the best example is the turmeric. So text mining, so natural language processing, extraction of 237 traditional uses from ancient Ayurvedic text of this turmeric. So compound analysis, AI assisted identification of 235 plus bioactive compounds beyond curcumin. Yes, already we all know that curcumin is present in turmeric, but the AI is identified 235 plus bioactive compounds. Then target prediction, computational prediction of 89 protein targets for key compounds. So the key compounds means this 235 compounds. It is interacted with near about 89 protein targets. So the formulation optimization AI design delivery system improving bioavailability by 27 times better than the earlier one. So the turmeric, that is curcuma lanca, has been used in Ayurvedic medicine for over 4,000 years for inflammation, wound healing, digestive disorders, and skin condition. But now you see it is going to interact with 89 protein targets. So we can find out the uses of the same turmeric for the different disease. That is the advantage of AI. By using network pharmacology, they found out this. Same thing for the DCM network pharmacology. The Qing Lo Yin, a traditional Chinese formulation for rheumatoid arthritis, contain 4 herbs and over 235 compounds with unknown mechanism of action. So the AI approach, that is, they have used network pharmacology algorithm mapped compound to target, revealing modulation of 28 protein in inflammatory pathway. So already they know it is having used in anti-inflammatory arthritis, but they don't know the mechanism. But now by using the AI approach, they found out this 235 compounds will interact with this 28 proteins in inflammatory pathway. Particularly, machine learning identifies synergetic combination of compounds targeting complementary pathways. Their outcomes validation studies confirmed predicted mechanism leading to optimized formulation with improved efficacy. Phase 2 clinical trials showed 62% response rate compared to 38% of standard therapy. So implication demonstrate how AI can decipher complex multi-compound mechanism, traditional remedies, potentially leading to novel combination therapies. Then cultural sensitivity, that is another important things. So respecting the traditional knowledge system, because from where we are taking, we have to acknowledge them. So acknowledging the cultural context of healing tradition and preserving traditional terminology and concept. Because some terminology they have used, suppose if you are taking Ayurveda, Siddha, TCM, they are using some terminology. So we have to preserve that terminology. Then involving traditional practitioners in AI development, that only I told. It is a interdisciplinary approach. So whenever you are integrating the traditional medicine with modern medicine, you have to involve the traditional practitioner also. So recognizing community ownership of knowledge, that is another important thing. So cultural sensitivity ensures that AI tools enhance rather than appropriate traditional medicine, maintaining its integrate while improving accessibility and validation. So ethical framework for integration, the Nagoya protocol and assess and benefit sharing, care principle, food traditional medicine strategy, and UNESCO declaration on bioethics and human rights. So these are some ethical frameworks are there for the integrating the traditional medicine with modern medicine. So intellectual property consideration, so that is a traditional knowledge digital library. So that is called as TKDL, has documented over 400,000 traditional formulation to prevent piracy through defensive disclosure, demonstrating how digitization can protect rather than exploit traditional knowledge. Because why we are going to make the digitalization to explore the knowledge, traditional knowledge, but same times you have to care about this one. We have to protect rather than exploit the traditional information. Yes, it is acceptable. We have to explore the traditional knowledge, but meanwhile we have to protect the IP also. Then benefits sharing models. So novel framework like biocultural community protocols and compensatory trust funds ensure community receive equitable benefits from commercialization of AI enhanced traditional remedies. Then patent innovation and internal framework. So these two will protect the IP. Then educational implication. So preparing next generation of pharmaceutical scientists, that is one is current gap, that is slowed education separating traditional medicine from conventional pharmaceutical sciences. Then limited computational training in pharmacy curricula. So this one we have to take up because what we are using the computational in training means in pharmacy curriculum is very limited. So you have to improve that one. Then insufficient cross-cultural competency development. That is also where we have to concentrate. Then near-term needs, So integration of traditional medicine principle into core pharmacy education, foundational data science and AI literacy for all pharmacy students, cross-disciplinary collaboration with computer science department. Future vision, integrative pharmaceutical science program combining traditional knowledge, modern pharmacology and computational methods. There will be a CPD, that is continuous professional development pathway for practicing pharmacists, global exchange program between traditional medicine institution and modern pharmacy schools. So implementation challenges in resources in limited settings. So low resource AI models optimized to run on basic hardware, offline functionality, then mobile first application, community knowledge, repositories, tiered implementation strategies, and South-South collaboration. So the promise of AI and traditional medicine integration must extend beyond wealthy nations to have meaningful global impact, particularly in region where traditional medicine remains the primary healthcare access point. So measuring success, so beyond the conventional metrics, so you have to find out the scientific validation, you have to measure this one, then clinical outcomes, accessibility and equity, then knowledge preservation. So building bridges between different epistemologies, so traditional knowledge and modern science. In traditional knowledge, it is a holistic, here reductionist, here phenomenological, here mechanistic, qualitative, quantitative, and here integrated with cultural, here claims cultural neutrality, intergeneration, empirism, controlled experimentation. AI as epistemological mediator between these two, traditional and modern. So AI system, particularly deep learning models, offer unique capabilities to bridge this different way of knowing. So pattern recognition in complex multi-dimensional data aligned with traditional holistic observation. Network models capture interconnected relationship central to traditional system thinking. Integration of qualitative and quantitative inputs enables translation between paradigms, then ability to operate with partial uncertain information, parallel real-world empirism. So towards a unified framework of healing, so you have to do these things. So healing, integration, a unified paradigm incorporating multiple healing tradition, then clinical practice models, so evidence-based protocols integrating traditional and modern approaches, then translational research methodologies that bridge traditional knowledge and modern science, theoretical framework, conceptual model, reconciling different medical epistemologists, then fundamental principles, shared values of patient-centeredness, evidence, and holistic approach. So these are the references what I have referred for my talk. So with this, thank you. Thank you for listening for the last 1 hour, 1.5 hours. Hello, ma'am. Hello. Hello. Hello, ma'am.
Yes, sir.
Yeah, I finished, ma'am.
Okay. Thank you, sir, for your insightful remarks on bridging the ancient wisdom and modern medicine, sir. I believe all our delegates will take a take-home message of learning more about artificial intelligence and implementing both traditional and modern medicines and artificial intelligence in their future work, sir. Delegates, do you have any questions?
Sir, good evening, sir.
Good evening, sir.
Sir, this is Professor Krishnamurthy.
Yeah, tell me, sir, how are you, sir?
How are you, sir? How are you, sir? Nice
Fine,
presentation,
thank you,
sir.
Thank you, sir.
Very nice
Thank you, sir.
presentation.
Thank you, sir.
Good correlation, sir.
Thank you, sir.
I think you can go for an extension of your activity with chemistry and AI, sir.
Okay, sir. Definitely, sir.
Yeah, definitely. It was very nice.
Okay, thank you, sir.
Thank you, sir. Thank you. No questions. I just want to have a
conversation
Okay.
with you.
Okay, thank you,
Thank
sir.
you very much, sir. Thank you very much, sir.
Thank you, sir.
Thank you so much, sir. Thank you so much, sir, for your session.
ஓ அது பழசா
Let's part for a quick tea break and then we'll gather for the valedictory address.
செஷன்லாம் கிடையாதுல்ல.
அவர் சீஃப் கெஸ்ட் அட்ரஸ் தான் கொடுப்பாரு.
அவ்வளவுதானே?
ஆமா, இந்த புக் லிஸ்ட் எழுதிட்டீங்கல்ல,
புக் ரிலீஸ் எழுதிட்டியாடா?
அப்ஸ்ட்ராக்ட் புக் சொல்லலையே. அது அப்ஸ்ட்ராக்ட் புக் ரிலீஸ்.
அத பெரிய காலேஜ்.
I now request our chief guest to release the abstract book அப்படின்னு சொல்லிட்டேன். நான் என்னுடைய அது யார் எதிர்பார்க்க
நிறைய பேசுறாரு. எல்லாருமே காலையில பேசுறவங்க கூட சாவிட்டாரு. ஹலோ ஹலோ,
அன்மியூட்ல இருக்கு.
ஹலோ, செக் செக் செக்.
செக். அன்தான் மேடம் இருக்கு. போடுறதாங்க
guests here. As we are approaching the climax of this seminar, I am extremely privileged to welcome you all for the mathematical ceremony on the international the role of artificial intelligence in integrating traditional and modern medicine. I would like to invite our dynamic principal, Professor Dr. Sinhari Ma'am, to deliver the welcome address.
Reading online. ഇതിലേ ഇല്ല വരലില്ല.
ലോക്ക് എടുത്തോളൂ.
ഇല്ല ഇത് അங்கே
எங்க அங்கோட்டு இருக்கீங்க.
ഹലോ ഇതിലേ Respected dignitaries on the dais and off the dais, a very pleasant evening to one and all gathered here. It's my pleasure and honor to warmly welcome you all to this valedictory function of the international seminar entitled The Role of Artificial Intelligence in Integrating Traditional and Modern Medicine, organized by the Department of Pharmacognosy, Periyar College of Pharmaceutical Sciences, Tiruchirappalli, accredited by the Tamil Nadu Dr. MGR Medical University, Chennai, under the continuing education program with 10 credit points. Throughout the day, since morning till evening, you have participated in various sessions and might have explored how artificial intelligence is transforming modern healthcare and how it harmonizes with and enhances the potential of our rich traditional system of medicine. I sincerely appreciate the enthusiastic participation of students, scholars, and faculty members from various institutions across Tamil Nadu and India. Over 41 institutions from 9 states, including Tamil Nadu, had participated in both the online and offline platforms, showcasing more than 90 e-posters and 44 oral presentations, totaling 134 in this event. It's a matter of pride to welcome the chief guest of today's valedictory function, Professor Jnanachandran, Director Pranav Institute of Pharmaceutical Sciences and Research, Gwalior. He has held various positions during his career, and to mention a few, he has worked as a Pharmacist Supervisor, Bishop Health Directorate, Ministry of Health, Kingdom of Saudi Arabia. Sir has held distinguished roles across many reputed institutions in South India and continues to inspire the pharmacy community through his vast experience, humble approach, and dedication to education and research. To his credit, he is a recipient of Best Pharmacist Award from Ministry of Health, Kingdom of Saudi Arabia, Lifetime Achievement Award from Madurai Medical College, Madurai, Indian Pharmacy Graduates Association Fellowship Award from Amrita Institute of Medical Sciences and Research Center, Kochi, and he had also carried out excellent research work in DRDO projects that contribute to national safety. His name is familiar in every academic circle, not just for his designations, but for the depth of his contributions, his mentorship, and his inspiring professional journey. He has visited several institutions, met with students, and shared his knowledge and experience. He often appreciates the scientific activities of PCPS, that is College of Pharmaceutical Sciences, online every time. On behalf of our institution, I wholeheartedly welcome you, sir. And we look forward to the valuable insights and inspiration you are about to share with us. I feel very glad to welcome and to express our gratitude to the distinguished Professor Dr. Raghavan sir. Once again, a warm welcome to the chief guest, organizing team, all delegates, faculty members, and students. Thank you, one and all.
Starting to honor our dignified guests, may I now request our principal ma'am to honor the guests by a round of applause.
Thank you, sir. I request our chief guest to release the abstract book. I request our chief guest, Dr. A. Jnanachandran sir and Dr. S. Raghavan sir, to release the abstract book.
வாங்க போங்க போங்க.
Thank you, sir. It gives me an immense pleasure to introduce our chief guest, Professor Dr. A.K. Jnanachandran is a distinguished academic and healthcare professor with over 25 years of teaching and academic leadership experience and 10 years of international service at the Ministry of Health, Kingdom of Saudi Arabia. He has completed his BPharm and MPharm degree from Madurai Medical College and has completed his PhD degree at Defense Research Development Establishment Gwalior with significant contribution in safe and effective tear gas compounds and the nuclear, biological and chemical warfare context. Professor Dr. Jnanachandran has begun his career in pharmaceutical marketing before transitioning into academia. He has mentored numerous undergraduate and postgraduate pharmacy students and remains a sought-after resource person, seminar speaker at national and international conferences. He is also recognized as a clinical pharmacist in energy management utilizing advanced pharmacotherapy and sublingual immunotherapy system to support patient care and disease control. He has been awarded various prestigious awards and also served as domestic and international advisor for Operant Pharmacy Federation and state advisor for Tamil Nadu All Registered Pharmacists Welfare Association. He continues to impact the pharmaceutical education, healthcare service delivery, and pharmaceutical sciences both in India and abroad through his work. We are delighted to have such a great personality among us. May I request our chief guest to deliver the valedictory address. May I request our chief guest to deliver the valedictory address.
That feedback, feedback.
I would like to call upon our delegates to share their valuable feedback with us.
See, I will be the first delegate. Maybe because of principal's kind gesture, she has given this speech. I want to say three things. This is the first college where I have seen same strength as I have seen in the morning. So that credit goes to Madam Vijayalakshmi. Okay. I am not supposed to sit along with the Madurai persons settled in Madhya Pradesh. But let me tell who I am. I am Dr. S. Raghavan, had 44 years experience, senior most professor in NIT Trichy. And I am specialized in microwave engineering. If you have seen the Wings of the Fire written by Dr. Kalam, one page has been devoted to Professor Bharati Bhatt. Because of her only, we won the recent Sindoor operation. Kargil war we won because of that lady. And I am her last scholar. This is different. I will take only 2 more minutes. I have got many hobbies. One of the hobbies is biomedical engineering. I can go to any hospital inside the operation theater. That kind of society member I have got. So I have come to your college after 2 years. Last time I came when a person talked about the drug, and today I have come just because I have seen AI in the industry. Now, having called me and made me sit here, I want to do a small service to your principal. What I will do is, some other day, your B.Pharm, M.Pharm, diploma, I will take a class on micro needle. Micro needle is considered as a PhD. ஒரு சின்ன drop போதும், you can do all kind of investigation. குடிச்சு குத்தி குத்தி பள்ளமா எடுத்துட்டு ஒரு மில்லி எடுத்துட்டு அப்படி இல்ல. ஒரு drop of blood will be sufficient. So I will talk on biomills, MEMS, microneedle, and also telemedicine. This is the only service I can show to your principal, vice principal, for having made me sit on the stage. So in any case, I really enjoyed from morning till now, and also going to enjoy this great lifetime achievement awards chief guest. So this is my enjoyment, and no negative, and same strength, no college you can expect. And last but one of the delegate is from Kalasalingam College. Kalasalingam College is the only college where they give BTech degree for handicapped persons. So in any case, I will write all my feedback, at least 2 pages, to principal and vice principal by email. I wish you all the best.
Good evening to all who are gathered here. This seminar, I am Bharani Madhavan from United College of Pharmacy, Coimbatore. This seminar was both insightful and thought-provoking. It effectively highlighted the emerging role of AI in bridging traditional and modern medical practice. The speakers brought diverse perspectives ranging from cutting-edge AI technologies to time-tested traditional healing system, which created a well-rounded discourse. Overall, the seminar successfully emphasized the potential of AI creating a more integrative and inclusive healthcare system. Thank you for Periyar College of Pharmaceutical Sciences to give me the opportunity. Thank you.
Delegates, maintain silence, please. Then only you can go early. Or otherwise, அப்படியே delay ஆயிட்டே தான் இருக்கும். Okay.
Now I request the students of United College of Pharmacy participate in study. The request is request to deliver the certificates to United College of Pharmacy.
So good evening, one and all. I am S. Prasanna from St. Joseph's College, Autonomous, Trichy. So the event was well organized and the organizing secretary, I have to thank the organizing secretary as I was the last person to register for this program. Ma'am made a call at 9 p.m. at night, and she at that time also she was well approachable, and she said, okay, it's okay, you can come and attend the program. So for that I would like to thank the ma'am. And the hospitality in this college was so good, and the food and all the facilities was so great, and all the lecture sessions with the lecture sessions with all the faculty members are so great. It gives me an immense pleasure to thank all the resource persons who enlighten us today. Thank you.
Thank you so much. We need a college student. Thank you everyone for sharing your views. There is always one point improvement when we try to overcome any of the shortcomings we have recently. Now I would like to invite our chief guest to address the relevant areas.
Good evening, respected Principal of Periyar College of Pharmaceutical Sciences, Dr. Sandhamani ma'am. I'm very happy of giving me the opportunity to come to this college. It is one of the legacy of pharmacy profession. This is Periyar College of Pharmaceutical Sciences. Since more than 40 years, I think this college is 44 years. This pharmacy college is giving high quality knowledge to the students. Once again, I thank you, ma'am, for giving me and calling me for this valedictory function of international seminar on application, role of artificial intelligence in translating, integrating the traditional medicine with modern medicine. And I appreciate all the dignitaries who are sitting on the dais. Our Raghavan sir, very senior most professor from NIT, Dr. Sakilana, and Madam Vijay Lakshmi, and our Vice Principal Krishnamurthy sir, and all the faculty members of this Periyar College of Pharmaceutical Sciences, and my dear young pharmacy students. I appreciate your dedication, involvement, and patience. You are sitting, I was just telling, our Raghavan sir telling that you were here morning to evening, just to gain the knowledge. And one of the delegate was telling the food was excellent here, hospitality was excellent, and above all, the knowledge sharing has been excellent, wonderful. You could have a lot of information from the eminent speakers like Dr. Mahadevan sir, Jayagant sir, and Ravichandran from Malaysia, who has given a speech about the role of artificial intelligence in integrating this modern medicine and old medicine, traditional medicines. My dear pharmacy students, I have been traveling all over the country, and I am seeing students from different culture, different religions, and different areas. One thing I observed is here in this college, this Periyar College of Pharmaceutical Sciences, the participation with total mind in this setting to come here to learn. When I came to this college, our principal ma'am had given me the privilege to take around the library. Thank you, madam. Because the library is a place. It's a place, the house of knowledge. Saraswati, you call it in Tamil. Saraswati. And the madam was arranging a lot of webinars. By Zoom meeting, Google Meet, to share the experience from different persons from across the globe. People from Saudi Arabia, people from Malaysia, Singapore. She's organized a wonderful efforts, but you are taking all your energy and stamina to give the best knowledge to our students. My dear pharmacy students, I mean, for last 30 plus years, I am doing one simple message of advancing pharmacy professor of India globally, everywhere. Madam was telling, I have received the best pharmacist award from Ministry of Health. I got it, not because of I have big knowledge, not because of the knowledge I have. See, as far as pharmacy is concerned, it is the backbone of health. When any patient becomes sick, நோயாளி வந்து நோய் வந்துட்டாங்கனாக்கா அவங்க ஃபர்ஸ்ட் டாக்டர் கிட்ட போவாங்க. என்ன டாக்டர் போனாக்கா அவர் டாக்டர் வந்து கண்டுபிடிச்சிருவாரு உங்களுக்கு வந்து ரெஸ்பிரேட்டரி இன்ஃபெக்ஷன் இருக்குன்னு சொல்லி. அதுக்கு அவர் மருந்து கொடுக்கணும். மருந்து வந்து எழுதி கொடுப்பாரு. அந்த மருந்தை பத்தி the complete medicine, what are the A to Z of medicine, the pharmacist knows. So I used to say, the doctor and the pharmacist are like two minds in one basket. The doctors do the diagnosis and the pharmacists give the drugs. So pharmacists are drug specialists, whereas doctors are disease specialists. And this international seminar about this incorporating the traditional medicine with modern medicine. Now the technological tools like AI, ML, deep learning, NLP, many things are coming out. But thing is, everything is for the benefit of the society, to give the innovations of technological innovation for societal benefit. Whom we are working? We are working for the community. When I was working in MOH, ma'am, all the patients when they come, they will meet the doctors. They will go to doctors, see the nurses, and finally they will come to the pharmacy. கடைசியா மருந்து வாங்க வருவாங்க, என்கிட்ட வருவாங்க. மருந்து வாங்குறப்ப நம்ம தான் வந்து நம்ம பார்மசி கோர்ஸ் வந்து மருந்தை பத்தி எல்லாம் படிச்சுக்கணும். மருந்து என்ன வேலை செய்யும், மருந்து எப்படி தயாரிக்கிறாங்க, மருந்து எப்படி ஸ்டோர் பண்ணணும், மருந்து லைஃப் ஸ்டைல் என்ன, லைஃப் ஆஃப் லைஃப் என்ன, இதெல்லாம் நான் ஃபார்மசி படிச்சிருக்கோம். ஸோ இவர் ட்ரக் எக்ஸ்பர்ட், ட்ரக் ஸ்பெஷலிஸ்ட். ஸோ அந்த ட்ரக் பத்தி நம்ம வந்து பேசிட்டு வந்தோம்னா ஒரு பிரிஸ்கிரிப்ஷன் வந்து அந்த பிரிஸ்கிரிப்ஷனை பார்த்து திஸ் பிரிஸ்கிரிப்ஷன் நம்ம எல்லாம் படிக்கணும். ஃபர்ஸ்ட் அதை படிச்சுட்டு அது என்ன பேஷண்ட், மேலா ஃபீமேலா, என்ன ஏஜ், அது என்ன டிசீஸ், என்ன மெடிசின்ஸ் இதில் எழுதி கொடுத்துருக்காங்கன்னு சொல்லி பார்த்துட்டு அப்புறம் அந்த பேஷண்ட் நேமை கூப்பிடணும். டாக்டர் விஜய், நம்ம பேஷண்ட் விஜயலட்சுமி விஜய் சொல்லுவாங்க. உங்களுக்கு வந்து இந்த 3 மருந்து எழுதி கொடுத்துருக்காங்க. முதல்ல ஒரு ஆன்டிபயாட்டிக், இது வந்து ஒரு நாளைக்கு வந்து காலையில் ஒன்று நைட்டு ஒன்று சாப்பிடணும், ஒரு 5 days சாப்பாட்டுக்கு முன்னே சாப்பிடணும். அதுக்கப்புறம் தலைவலி மாத்திரை எழுதி கொடுத்துருக்காங்க, அது ஒரு நாளைக்கு 3 வேளை சாப்பிடணும். அது கூட இன்னொரு மாத்திரை எழுதி கொடுத்துருக்காங்க, இந்த தூக்கம் வரும், அது நைட் மட்டும் சாப்பிடணும். இந்த மாதிரி ஒரு மருந்தை பத்தி எல்லாம் எடுத்து கொடுத்தோம்னாக்கா திஸ் ஐ டு டாக் இன் அரபிக் தேர் லாங்குவேஜ். When I went to Saudi Arabia, I was not knowing Arabic. Slowly I learned Arabic. I will tell in Arabic this message. See that Salam alaikum rahmatullah barakatuh. Penny madam is the secretary. आपको मालूम है Salam alaikum rahmatullah barakatuh. That means I wish everyone to be happy and healthy. அவங்க சொல்லுவாங்க alaikum salam. I also wish you the same. When the patient comes to me, I take the medicine on the Hebrew Haganta, on the fee Ras, on the fee Muskila, on the G Hilaj, Akil, Hamba Talatamara, Aktalatenu, on the Gabilakal Mother. I tell every information about the medicines to the patient by seeing eye to eye. When they get the message, the patients feel very happy. By making the patient very happy, the patient disease 50% is psychologically it is gone. Psychologically, the patient feels happy. I come to a good place. I come to a person who knows about the medicine. I come to a place where he tells about the medicines. The doctors give the medicine. He is the person, the pharmacist. They only make the medicine. We only make the medicine. We only make the medicine. We only standardize the medicine. The pharmacist is you. You are our future pharmacist. You make the medicine. We just show you the path. And then we tell to the community, this medicine is what happens. And the column Sayyid Ali Qais, Wallahi and Sayyid Ali Qais. They say in Arabic to me. At 10 years I worked in there, Wallahi Sayyid Ali Qais. And the column Qais. That means this pharmacist is good, really. This pharmacist is very good. Normally in Islam country, I am the only person who was talking. I went as a normal pharmacist. I went only to give the medicine. Then I told the ministry, see, by giving me opportunity, I come to Saudi Arabia. You give me opportunity. I come here. And I easy have to be Madad Haganta. I come here to do service for you. But you are not utilizing my full services. I told them. I come here, then they promoted me. We will make you as a pharmacy supervisor about 40 hospitals. You should go and verify the pharmacists everywhere, how they are keeping the medicines they are packing. See, in the pharmacy, how the medicines to be kept, we have to know. So these things I store properly, and the patient counseling I was doing it. That is why they have given me best pharmacist award. They have given me this pharmacist award for 10 years of service. When I coming to you, this international seminar is to discuss about these various developments. I was talking in the previous college morning. I was talking with another set of students. இப்போ இன்னைக்கு வந்து ஒரு தொண்டையில வந்து ஒரு இது வருது, ஜலதோஷம் வருது. When you get cold, the old medicine கோல்டு வந்தானாக்கா நார்மலா வச்சு யூ டேக் மஞ்சள் கொடுங்க, மஞ்சள்ல பால்ல மஞ்சள் கலந்து கொடுங்க சொல்லுவாங்க. நைட் தூங்குறப்ப பால்ல மஞ்சள் பெப்பர் கலந்து கொடுப்பேன்னு சொல்லுவாங்க. That is turmeric with pepper. Turmeric has got lot of activities: antiseptic, anti-inflammatory, antibiotic. With pepper, pepper is a mucolytic. It increases it breaks down the tenacious mucus and it expels out. So in the traditional medicine turmeric, curcumin. The modern medicine is bromoxyl hydrochloride, carbocysteine. So these are the combination. These 2 days, this 1 day international seminar is to combine the traditional medicine with modern medicine. Morning I was talking with a set of students for the management of cancer.
Yes, please, sir.
Morning I was talking with a set of students about the management of treatment of cancer. About cancer, there are many drugs available. Cancer very dangerous diseases. The cancer is increasing alarmingly, particularly in India, because the food habits, lifestyle, all these things. They are making the cancer fit. I am seeing in hospital where I go. Before coming here, I used to meet the hospital. Before coming here, I went to the hospital, the cancer hospital. They are telling every day they are getting about 50 patients and 300 patients already in the ward. Every day 50 new cases are coming. New cases are coming of cancer. And I appreciate Madam Sandamara Madam, you are doing a lot of activities for cancer. Excellent, madam. Because this cancer is very, very alarming and the cancer cure rate is very less. Cancer cure rate is very less. So we have to do the early diagnosis. நம்ம சொல்றோம் என்னதான் early diagnosis பண்ணா கூட அந்த treatment cost of treatment, diagnosis of cancer, treatment of cancer, particularly when you go for chemotherapy, radiation, surgical, lot of cases, particularly for mainly breast cancer, lung cancer, cervical cancer, prostate cancer, all organs. It is because the genetic factor is one thing, but because of the lifestyle, the food habit. When you take milk in the morning, the milk contains oxytocin. You know, thus they give to the cow oxytocin in order to get more milk. So knowingly they are taking a hormone which may cause symptoms of carcinogenic. And many medicines, I'll tell you the latest ranitidine, Zintac. Zintac is an anti H2 receptor antagonist. Zintac, ranitidine. Now it was not so before. Doctors, when they give any medicine, there is only 3 medicines. Now, if you have prescription, it contains 7-8 medicines. And one is definitely there is an antacid. The proton pump inhibitor, omeprazole, or rabiprazole, or ranitidine. This ranitidine on storage. My dear young student, this is a message for you. My dear young students, ranitidine is H2 receptor antagonist. On storage, it develops impurities, nitrosodimethylamine, and this is carcinogenic. Still, it has not come to Indian continent. It is banned other countries. Ranitidine, Zintac. So these are our learnings. See, you have come here. We also learn. When I went to the library, but once again I feel very happy. You took me to the library. It is a very pleasant visit to the library of Pereira College of Pharmaceutical Sciences, where there is depth of knowledge. Depth of knowledge in all the activities, all the areas. My dear young students, make use of this opportunity. Make use of the opportunity. You have 4 years of reform learning. You have to gain a lot of experience. And this is the knowledge. You are going to apply this knowledge to the community. Today, India is known all over the world. I'm telling you, pharmaceutical drugs and pharmaceutical made in India is well accepted in America. How? It is because of our young students who are working in different countries. They are doing good quality formulations. And it is because of our excellent faculty members. They are giving the best knowledge to the students. So that is why our students are able to go confidently. When I have a stuff, when I have an information, I can come and talk to you. I can share my experience to you. So my dear pharmacy students, your future is very bright. There is a lot of opportunities. We are here to guide you, to inspire you, to motivate you, to lead you, to take you to the best. Anything in the pharmaceutical services, you feel free to contact us. If you want any help, anything you want suggestions, we are here. You can reach me through the Department of Pharmaceutical Sciences, the Periyar College of Pharmaceutical Sciences in Trichy. So this is the small message, my dear pharma students. Everyone, you come, learn, and before I conclude, you do BPharm today, get job, and go for PG, post-graduation. After post-graduation, go for PhD. After PhD, go for postdoctorate fellowship. Because learning is non-stop. See, madam, I was talking, wave after wave, மீண்டும் பார்த்தீங்கன்னா அலை வந்துகிட்டே இருக்கு. இன்னைக்கு ஒரு வெபினார், நாளைக்கு ஒரு வெபினார், இன்னைக்கு ஒரு செமினார். This is what? For whom? Only for our young pharmacy students, for the young faculty members. So make use of this opportunity. I could see one of the staff member telling here, I feel tired, I worked heavy. No, you feel tired because you are done only for one day. If you do every day, you will not feel tired. Every day, that daily work பண்ணல, you will not be tired. நம்மள when we say, when you do some exercise, பண்றது வலிக்கும். பண்றது வலிக்கும். ஒரு 2 நாள் பண்ணாக்கா வலி தெரியாது. நல்ல ஒரு பலம் வந்துடும். இந்த மாதிரி pharmacy student நல்லா படிங்க, மென்மேலும் படிங்க, படிச்சுட்டே இருங்க. I am still learning. At the age of 70, I am still learning. I am going places. I am learning from you. I am learning from you. I learn from my students. I teach students. I also learn from you. So learning is a vice versa, and it is a give and take policy. Like you are pharmacy graduates. You take industry of pharmaceutical industry globally. So with this free message, I thank you once again, Madam Chandamara, Madam, for inviting me for this valedictory concert. I wish every pharmacist student feel proud to be a pharmacist. I want to tell before I conclude, see, there is a National Defense Academy, NDA. This is the area where pharmacy students can work in Indian Army, Indian Navy, and Indian Air Force as a pharmacist. You keep in mind, madam, you only keep in mind, NDA. You can tell your students to keep in mind, go for a placement. There will be a lot of respect, lot of remuneration, lot of money will be there. You are going to see the soldiers in the field side. They are going to serve the country. So this one information I want to share with this youngster about this NDA. Normally you will get jobs, many jobs. This job is very excellent job. Working for the country from behind, serving the soldiers, and you will get a lot of respect. So thank you once again, madam. I wish everyone of you a bright and a prosperous future. Very nice communication.
For sharing your invaluable experience with us and motivating all our babies for higher education. It's an honor to have you here, sir. Thank you, sir. Around 134 research papers were received from various states of India and Malaysia, out of which the participants presented 19 key posters and 44 oral presentations. With the help of our brilliant panel of judges, Dr. P. Marinarajan, Dr. Kalan Pharmacy, Dr. Vilash from Vedic Institute of Science, Technology and Advanced Studies, Chennai, R. Mani, Madras Medical College, Chennai, A. Sekamani and Dr. A. Krishnavedi from College of Pharmacy, Government Medical College. We have selected few best speakers here. Now I am just actually guest to hand over certification memento to the witness. The creator of University Malaysia. Mohammed Rahman, Government Medical College, Chennai.
Audience, please maintain silence. Only few more minutes.
Congratulations, Institute of Medical Sciences, College of Pharmacy, Trichy. Ramakrishna Institute of Mathematical Sciences, Bangalore. Ramakrishna Institute of Mathematical Sciences. Yes, Prasanna, Saint College. Yes, Prasanna, Saint College. Gratitude is the rarest blossom which springs from the soul. I would like to invite the University Generation Associate Professor, Department of Pharmacy, to deliver the word of thanks.
இது வீடியோ வராதா?
A very good evening to one and all gathered here as we come to the end of this enlightening and inspiring international seminar on the role of AI in integrating traditional and modern medicine. It's my privilege to propose a vote of thanks. First and foremost, I would like to extend my heartfelt gratitude to the management for their unwavering support and vision in making this conference a reality. The commitment to the fostering innovation and collaboration has been the driving force behind the successful event. We are incredibly honored to have the presence of Dr. A.K. Jnanachandran, Professor and Director, Tranmere Institute of Pharmaceutical Sciences and Research, Gwalior. Thank you, sir, for gracing this occasion with your esteemed presence and for sharing your invaluable insights. A special and sincere thanks to our esteemed principal, Dr. Sendamari Ma'am, for her exemplary leadership and guidance. Her encouragement and wisdom has been invaluable in every stage of planning and execution. We are truly fortunate to have her as our pillar of strength. Thank you, ma'am. My gratitude also goes to our dynamic Vice Principal, Dr. G. Krishnamurthy, sir, for his continuous support and tireless efforts. Thank you, sir. We are immensely thankful to the heads of all the departments for the cooperation and support. Their collaboration had ensured a cohesive and interdisciplinary approach to this seminar. I would like to express my sincere appreciation to all the teachings and non-teaching staffs. Your hard work, dedication, and long hours of behind the scenes have been instrumental in the success of this event. A special note of thanks to all the delegates from various colleges who have participated with such enthusiasm. Your contribution through the oral presentations and e-posters have made this a truly rich and diverse platform for knowledge exchange. With a total of 315 participants, your presence has truly made this event a grand success. I extend my gratitude to the principal of all the participating in colleges for encouraging the student and faculty to be a part of this significant seminar. We are deeply thankful to the Dr. MGR Medical University for providing the CPE accreditation, which adds immense value and prestige to our conference. A big thank you to all the committee members and volunteers. Your dedication, hard work, and commitment have been the backbone of this event. Your efforts in managing everything from registration to technical support are highly appreciated. I would like to also thank the attendants, electricians, photographers for the diligent and timely service. Your support has ensured that all our needs were met and that the entire event was captured beautifully for posterity. Last but not the least, I thank each and everyone for your presence and active participation. Your interest and engagement in the seminar have made this a truly memorable and productive experience. Thank you all once again. Thank you.
Thank you one and all for making this event grand success. Thank you.
Anyone know if questions with me? Correct your right hand to the
Very good. Sir, practice. Sir, control for practice. Previously, what Uma madam. Ganapalana. Uma madam. Sir, you punish me. Sir, send it to student. Complicated. Para.